arrested bed.
Oh, this is your written, okay, gotcha. Okay. So you're testifying on 1537. That's not today, is it?
Yes, it is. This is exactly.
Oh, here, oh, the blurb. Never mind. Okay.
You haven't quite get there yet.
I'm just gonna write blurb up here, so.
I like to tell young kids who are being homeschooled, I homeschooled my boys, and that's okay. They're functioning adults in society.
Is we know there are other items like
Good morning. I'm just reminding everybody that sometimes the knocking gauge is a better choice. And it's very hard. I'm reminding myself as well as everyone else.
with that, I would be trying to say, yeah,
open the hearing on House Bill 1224, prohibiting state and local governments from adopting certain mandates in response to COVID-19, and prohibiting employers in places of public accommodation from discriminating on the basis of vaccination status. Is the principal sponsor, Representative Baldessaro, here to present his bill? Is someone else, a co-sponsor, prepared to present his bill? Okay, the chair recognizes Representative Leah Cushman, who is a co-sponsor.
Thank you, Mr. Chairman. I was not expecting to introduce this bill, so I very much apologize. The prime sponsor drafted this bill to prohibit state or local government agencies from requiring masks or other facial coverings in response to COVID-19 or other infectious diseases. That's part one of the bill. It amends 141C, which is the communicable disease chapter, basically not allowing mask mandates of any kind. And let's see, also to prevent state or local government agencies from issuing immunity passports or similar standardized documentation of COVID-19 vaccination status, basically preventing any state or local requirement to prove that you've been vaccinated for COVID-19. And also part 3, prohibiting businesses from requiring documentation of COVID-19 vaccination statuses. So that is the part that applies to private businesses. And that applies to any goods, facilities, advantages, privileges, licensing, educational opportunities, healthcare access, or employment. And prevents employers from refusing employment to anyone for failure to produce evidence of COVID-19 vaccination, and also to prevent discrimination from public accommodation. So that would be any public-facing business. They can't keep people out based on vaccination status.
You think very well on your feet. You wouldn't ever happen to run into emergencies as a nurse, would you?
Sometimes.
Since you're a co-sponsor, would you take some questions?
Yes.
Representative Knark.
Thank you very much. You did a great job for hearing about having to do it 30 seconds before you did it. But I do have a question. It comes down to what we've already discussed in some of the other bills. Lines 27 through 29 have been superseded by the Supreme Court ruling regarding the CMS mandate for healthcare facilities. And obviously, this bill was written way back in September, long before we knew that was going to come down. Mm-hmm. But would you agree that that part needs to therefore be removed from this bill because of the impact it will have upon basically the closure of almost all of our healthcare facilities?
So I've actually been doing some research on that, and I've spoken with the 10th Amendment Center, and I also spoke with some people in Florida where they passed a bill that allowed for broad exemptions to employer mandates. So an exemption could be a potential amendment change this to an exemption clause that just, you know, provides a simple exemption process. Whereas now, when people apply for a religious or medical exemption, they're kind of being put through a arduous process where they're facing kind of a lot of resistance, and the employers are just trying to tire them out and or turning it into a religious inquisition. So it would have essentially the same effect, at least someone who has a conscientious objection or is immune to COVID. That's kind of how the Florida law is written. But even if we were to pass like a straight mandate ban, like this bill proposes, the idea that the federal government would, you know, take the money from our hospitals is, I don't think that would actually, that they would go that far. I think that it would come down to how strongly the state stands on its right to legislate and have its laws compared to a federal rule. You know, I think that a legislatively passed law would hold more standing than a federal rule.
May I have a
Follow up.
If you, when reading the Supreme Court decision on that particular part, the CMS mandate, they explicitly made the point that for Medicare and Medicaid, that the federal government is paying the bill. Well, half of Medicaid got it. They pay the bill, and therefore they have the right to be able to place reasonable restrictions for the use of the money that they're giving, because they were trying to protect the patients. So do we have the authority to countermand that, or does the CMS mandate dictate how the exemptions work? That part I do not know.
It doesn't. It only specifies that there are medical and religious exemptions, but in Florida, they have other exemptions, and they have not had any issues, even since the court ruling.
Yet.
Representative Gay?
Thank you, Madam Chair. Thank you, Leah. Would this bill have to have any kind of amendment to do what Florida has done, which is make the request for exemptions less onerous?
There would have to be amendment because right now it just says that they may not. So like it could be a carve out just for the CMS, but even that is only theoretical because technically Florida's law goes against what the CMS regulations dictate, and they have not had any issue with CMS certification being revoked or refusal to pay by the federal government. And I think that when it comes down to it, that the federal government is not going to close our hospitals over this.
Mm-hmm.
Representative Merchant.
Thank you, Mr. Chairman, and thank you, Representative Cushman, for taking my question. Would you, not you personally, but would the state be willing to financially support the hospitals in the event that the federal government did, in fact, stop sending the money to the state? Would the state be willing to fund the coffers so that hospitals would not be in peril of not being able to provide patient care?
That is a good question of which I do not know the answer.
Thank you. Anyone else with a question? I have one. What about a little mom and pop shop where either mom or pop or both are getting a little older and have a few health concerns, and they have 3 or 4 employees and they just don't want to get sick? This bill would say it will be illegal for them to say, you got to get a vaccine if you're going to keep working here. Is that correct?
That is correct. However, under federal law, already no business can deny medical or religious exemptions already. If a employee of a business with one employer and one employee, and that one employee submits a request for religious accommodation or a request for disability accommodation, under federal law, they already have to grant it. The issue that we're having is not really with the small businesses. Small businesses typically have been accommodating and not turning it into a arduous process for employees. Really what we've seen a lot is the larger corporate entities who have teams of lawyers at their disposal writing their exemption policies to sidestep that federal process for exemption. So really, the point is that no business can really say that 100% of their employees need to be vaccinated. They can make the process for exemption more difficult or less difficult, but there is always that Civil Rights Act of 1964 exception.
Another question is, under the religious exemption, I'm thinking back to the time of the Vietnam War when people would want to be conscientious objectors on religious grounds. And it's quite understood that people who were members of the historic peace churches, if they raised a conscientious objection, that was quite easy because they belonged to a so-called peace church. But somebody who did not belong to it, who belonged to a different kind of church, and in fact had no difficulty with the Korean War or World War II, now just didn't want to go to Vietnam, it was very, very difficult for the religious exemption card to be played. Is the drift in this bill such that it is hoped that the religious exemption is now much, much broader?
Well, this actually doesn't speak to religious exemption at all. It just says that anybody for any reason does not have to be forced to take a vaccine.
Okay, thank you. Representative Weber.
Thanks. I think I'll save it for the exec session. Thank you.
Any other questions for the representative? Seeing none, thank you. Thank you for pinch hitting. Chair recognizes Lori Ortolano, who is representing herself and supports the bill and wishes to speak for 3 minutes.
Good morning. My name is Lori Ortolano. I live in Nashua. I didn't prepare testimony because I didn't anticipate I was going to speak, but as I looked at these bills, I thought I'd pitch in a little. I'm really a person who enjoys choice and believe choice is very important. And I'm here in support of these bills because the other choice, it seems like there's a lot of bills that go on the other side, I'm more opposed to than this. But I feel as though we're still legislating too much from fear, from a space of fear, and we're not recognizing and gathering the kind of data and looking at the type of data we should be looking at in response to this. You know, I've come a long way. I masked like a maniac. I had a mask on 3 weeks before masks were called for because my husband ran a company in China, and what was going on over there was so difficult, and I was talking to a lot of his Chinese workers, and you know, they were all about getting a mask on. So mask went on me when I was walking through the market. I was the only person wearing one. And, you know, I've come a long way in reading and learning and studying and feeling as though that fear was not justified fully in the beginning. And I think our data has always supported that this is a disease that affected a segment of the population most heavily, the older people. But we reacted as if we needed a care policy that treated people from 0 to 100 the same way, with the same regulations and restrictions. And I think that's been a big error. I come from a city that closed the public schools for 13 months, longer than anyone, I believe, in the state. The impact to our kids has been devastating. And our teachers are pushing to close again right now. This is enormously difficult for parents. And all the private schools in our area are allowing choice. When the Catholic school a half a mile from me opened, I thought in the fall with choice, masking choice, I thought they were gonna have a big problem. And it seemed as though 80-90% of the parents were sending their kids without masks. It was high. I was shocked. I said, these schools are going to close. They never did. They came through it just fine. The public schools with a full mask policy had to close for days because of elevated sickness and teacher shortages that were, ridiculous. 400 teachers out. I don't know why that's happening, but I know that choice is very important to me. And my husband runs a good-sized company with employees all over the world, and he never instituted a policy for his employees because he had a lot of young people. The older people took the vaccine, the younger people didn't want to. And he didn't feel comfortable mandating it because he really wasn't 100% certain he understood the risks. His company came through it beautifully. And the younger people recovered quickly. They were forced to stay out the 10 days. They had an awesome remote system for working, so they maintained profitability. They had the highest profit returns for the last 2 years than they ever had. He never thought he'd grow his company the way he did because remote working enhanced his business a great deal. And when his employees were out, they kept plugging. I mean, the day COVID hit, he set up a remote workstation, and he worked an 8-10-hour day that day. And he put all his employees on it. He never missed a day. So I'm very concerned about, these types of bills both ways that push a one-size-fits-all protocol for every segment of the population. I think data is starting to show us, particularly from Europe, that we have probably made some mistakes, and we have a medical system that is driven by profit, unlike European countries. We have to be very careful about this and considering what's going on here. So I would just urge a tremendous amount of caution on this and thoughtful deliberations in an open mind and no judgment. No shaming, just recognize that we've all been through a lot. And my opinions are very thoughtful opinions I share with you. And I appreciate you giving me the time. Thank you.
Thank you very much. Would you take any questions from the committee?
Certainly.
Seeing none, thank you so much for your testimony.
Thank you.
The chair now recognizes Paula Minahan, New Hampshire Hospital Association, has written testimony. She indicates she's coming to oppose the bill.
Good morning, Mr. Chairman, members of the committee. For the record, my name is Paula Minahan, Senior Vice President, State Government Relations for the New Hampshire Hospital Association. We are opposed to House Bill 220 FN. This legislation has a number of sections, as has been outlined, that related to restrictions on towns or cities being able to determine whether or not a mask requirement will be imposed in that city or town, restrictions on state government entities being able to certify an individual's COVID vaccination status, prohibiting private businesses in the state to require verification of vaccination status, and prohibiting discrimination on the basis of COVID-19 vaccination status. Needless to say, a very broad and far-reaching bill, a piece of legislation. We are opposed to the entire bill, but I will focus my comments today on the sections that would impact our member hospitals as private employers. As I think a lot of you know, the Hospital Association and its member hospitals announced in August of last year a consensus statement in support of requiring our healthcare workforce to be vaccinated against COVID in order to protect the health and safety of our patients, our staff, and our communities. Hospitals have announced their own individual policies and have been implementing them with robust education for their staff about the important benefits of vaccine. In doing so, hospitals have sought to be flexible and have complied with all relevant state and federal guidelines, including offering medical and religious exemptions. The decision to require their employees to be vaccinated against COVID was done to ensure the health and safety of their patients, their workforce, and their communities. They have seen firsthand the devastation that COVID-19 can have on their patients, especially those that are unvaccinated. Hospitals have an inherent responsibility to protect the health and safety of their patients who by their very nature are very ill, and the COVID-19 vaccine is the most effective way we can do that. Requiring vaccines of healthcare workers from communicable diseases is not new for hospitals in New Hampshire. Hospitals have required vaccinations against several communicable and deadly diseases such as mumps, measles, rubella, chickenpox, diphtheria, tetanus, pertussis, and influenza as a condition of employment, with the same type of medical and religious exemptions now allowed for under COVID-19 vaccine. We believe it is absolutely the right thing to do for the health and safety of our patients, our staff, and the citizens of New Hampshire. Furthermore, to make such a vaccination requirement an unlawful discriminatory practice, as stated in this legislation, would have a chilling effect on employers in the state of New Hampshire, not to mention an increase in lawsuits as stated in the fiscal note. The cost to the state if this bill were to be passed is significant. For all these reasons, we are opposed to House Bill 224, and thank you for the opportunity to share my views with you.
Any questions for Ms. Minahan? And thank you for coming and sharing. Representative Leon.
Thank you, Mr. Chairman, and thank you for being here again today. My question is, there are other states where hospitals have employees who are vaccinated and COVID positive working. Is that something that hospitals in New Hampshire would do to allow COVID positive healthcare practitioners to work in order to fill the gaps?
The hospitals have a workforce shortage, and a number of staff have been out due to coming down with COVID, breakthrough cases, and they have been out because of that. As far as how long they have been out before they're able to come back, I believe they're following the CDC guidelines relative to that.
Okay, thank you. Follow-up?
Yes.
Yes, thank you. And as a follow-up, if policy ever allows active COVID positive employees to work, would you loosen the would you be in favor of loosening the vaccination requirement if we are having healthcare professionals who are COVID positive working in our New Hampshire hospitals?
I can't really answer that hypothetical question.
Thank you.
I will follow up on that, by which you mean you haven't thought it through or you're not prepared to tell us?
I have not thought that through, so I do not feel that I'm able to answer that question at this time.
Thank you.
You're welcome.
Representative Soloway.
And
Welcome back. We missed you yesterday.
thank you. Vice President Minahan, it's always glad to see you.
Nice to see you.
Were you aware that one of the premier healthcare institutions in this country, Cleveland Clinic, placed on unpaid leave this morning 750 unvaccinated employees?
I was not aware of that.
That is, I have colleagues at Cleveland Clinic where it comes from. A quick follow-up. Thank you, Mr. Chairman. And did you have any notice that some organizations such as Cleveland Clinic, this is new today, have clamped down on medical exemptions for vaccination and are basically not allowing almost any of them?
I can only speak to what my experience is in New Hampshire with our hospitals, and my understanding is from not every single hospital has fully implemented their policies, but they have been, my understanding is very generous and working with the employees to try to work through if they request a medical or a religious exemption. And the fact is that we have about 1% of staff that actually were affected if they did not receive an exemption and were not able to remain in employment. You're welcome.
Learn from you.
You're welcome.
Representative Folsom.
Thank you, Chairman, and thank you for taking
Sure.
my question. Can you please describe, I know it's going to be kind of a broad description, but can you please describe the typical process someone has to go through for a medical exemption or a religious exemption for having, not taking the vaccine?
There is a process, there is a committee. It varies by hospital. These are not mandated processes. Each facility goes through, but again, they've been, as my testimony indicated, they have been had these in place for influenza and other required vaccinations for years. So there is a policy that the hospitals have, and an individual does go through that process, and there is a committee that reviews those. And I think for medical, it's obviously a little different than religious, but again, they do have those in place. It is not one individual making this decision. It is a committee.
Yes, to follow up.
Thank you. I think I probably didn't ask it very well, but what does the employee have to provide to this committee during this process? Do they have to have signed slips from doctors? Do they have to show their medical records? Do they have to have something signed by their pastor, priest, or whatever?
I will need to get back to you. I don't know exactly what they have to submit. I don't believe medical records are necessary. I think there's a physician attestation required. But as far as on the religious side, I would need to get a little bit more information for you, which I'm happy to.
Thank you.
Any further questions for Ms. Minahan? Representative Gay.
Thank you, Mr. Chairman, and thank you for taking my questions. I actually have three. Okay, the first one is, are the hospitals willing to accept the liability for employees when they suffer adverse reactions to the vaccines? The second question.
Let her answer the first one,
Okay,
please.
thank you.
There is a law that was passed last year that addresses that, so I think that kind of speaks for itself.
For those of us who don't remember what that was, even though we were part of it,
I need to look it up, to be honest. I have this year's bills in my head, but I will find it.
I claim exemption on the basis of age.
I'm right there. I'm right there with you.
I'm not so sure. Representative Gay, number 2, please.
When are you going to permit the usage of old-time medicines that have been proven effective in over 160 trials, clinical trials worldwide?
I don't believe I'm capable or qualified to answer that question.
Number 3.
What is the New Hampshire Association policy about people with natural immunity?
As I believe my testimony in various bills in front of this committee, the hospitals support the vaccinations and again follow CDC guidelines that say vaccinations, even if you have already had COVID, are superior to not being vaccinated.
One more.
What policy what studies the decisions being made about people having natural immunity as opposed to simply having a vaccine? I do understand that currently the opinion is, at least by some people, that having had COVID and having natural immunity and having a vaccine is rated the best protection. But that's not what the hospitals require. So are they going to adopt the similar studies that say people who have a natural immunity have superior protection than the people who have just vaccines?
That is a question for our clinicians that I would need to talk with them about that question.
Thank you.
Thank you. Representative Merchant.
Thank you, Mr. Chairman. Also, thank you, Ms. Minahan, for taking my question. we have a long history in the state, I think also in this country, of trying to allow business owners to run the business the way they think it should be run. Does this, in fact, in your opinion, infringe upon that right for the business owner to run the business the way they want to and enjoy the fruits of their labor?
Yes, I agree with that statement.
Representative Leon.
Thank you, Mr. Chairman, and thank you. I found the law that was passed last year. It provides liability for any hospital who's operating and complying with any executive order, agency order, or rule, including but not limited to waivers from CMS and the Department of Health and Human Services. So as long as the hospitals are complying with any of these rules, their liability is protected against vaccine injury, against anything else. But it does not appear to limit the liability for anything if the hospitals are not following any of those rules or guidelines. Do you think that that's influencing the policy, and do you think that that is the state dictating how the hospitals practice their business?
No, I do not.
Any other questions for Ms. Minahan? Seeing none, thank you for your testimony. Chair recognizes Kate Fry from New Futures. Who also has written testimony to pass around.
Good morning. Such a process now. My name is Kate Fry. I'm the Vice President of Advocacy at New Futures. Thank you for the opportunity to testify on House Bill 1224. New Futures is a nonpartisan nonprofit organization that advocates, educates, and collaborates to improve the health and wellness of all New Hampshire residents. In this role, we work extensively with policymakers, healthcare providers, and communities to improve the overall public health and improve health equity in the Granite State. New Futures support public health policy measures that decrease illness and disease. As you've heard, HB 1224 does a number of things, including prohibiting state or local government agencies from requiring masks or other facial coverings in response to COVID. It also prohibits businesses from requiring documentation of COVID for vaccination status. New Hampshire doesn't have either mandate at this point. Time and time again, public health experts have said that wearing masks and widespread vaccination, including both booster shots, is the best way to lessen the impact of the COVID-19 pandemic. Based on that, public health science, and advice from medical experts, some employers, such as hospitals, healthcare organizations, and nursing homes, have made decisions to mandate masks and vaccines for health and safety of their employers and the individuals that they serve. The freedom to make these decisions should be left up to those entities. State government should not prevent organizations from making choice based on public health safety concerns, especially during a public health pandemic. Businesses and healthcare providers now more than ever need the flexibility for the health of their employees, clients, and patients. So we ask the committee to vote in expedient to legislate. I do have written testimony that I'll leave with you.
Thank you. And while that's coming around, would you take some questions? Representative Knurk.
Just a quick one. You mentioned that the difficulty of needing to be nimble to be able to respond for the businesses. But would you agree that in general it is a bad policy to place into statute how public health officials will respond? Because this applies not just to COVID-19 but to other infectious diseases. Could this be a problem if we face something else and we're not able to respond in an appropriate fashion?
Yes, thank you for the question, Representative. I completely agree. I did work at the Division of Public Health Services at some point in time, and I do know that things are ever changing. You have to be fluid, so I would agree with you that you need that flexibility.
Representative Leon.
Thank you, Mr. Chairman, and thank you for taking the question. I appreciate that you're trying to respect these rights of these businesses. I'm curious if you know that there's a certain point with corporations and other businesses where because of how they work with the state, they're actually trading off their own personal risk? And do you think that weighs into whether or not they need to appreciate the personal risk of their employees and customers for that trade-off for protection from the state?
Thank you for the question, Representative. Unfortunately, I can't answer that question. I'm not knowledgeable in employees and risk. I'm sure there are a lot of people who are, but I appreciate the question.
Thank you.
Representative Folsom.
Thank you, Chairman. Thank you for taking my question. We've heard how hospitals often require other vaccines up front. But if you are going to work at a company and they ask for no other documentation of any other vaccines, should they be allowed to force their employees to take this one?
I think that is something that has to be, again, up to the employer. That's based on flexibility. I mean, there, as the Representative Canuck said, that there's changing policies and situations. So I really would leave that up to the employer.
Thank you so much for your testimony.
Thank you so much.
Chair recognizes Dr. Jay Corson from Manchester, who is in support of the bill. Doctor, please come. And what is your doctorate in?
My doctorate is in chiropractic.
Okay.
I'm a chiropractic physician. I'm a New Hampshire state resident. I've moved here from Rhode Island, and
Welcome to the North.
thank you. It's part of my story is part of my testimony. Actually, I didn't plan on addressing some of these topics, but after having listened to some of the other testimony, I've been feel compelled to add some things to my testimony. We just heard that from previous testimonies that because we require these other vaccines that we should, it should be a policy that we require this COVID-19 vaccine. We shouldn't question it because, well, of course, we require other vaccines. But I don't think those testimonies take into account that the VAERS, the Vaccine Adverse Event Reporting System, now has registered unprecedented amounts of side effects and damages to people, including deaths that never happened with any of the other vaccines. And to call this experimental medication that they're a vaccine, I think is unfair as well, because this is not a vaccine by definition until they change the definition. This is really an experimental medication that's really gone awry. I'd also like to talk about the efficacy of this vaccine. We're finding out now that people who have taken this vaccine it's creating a negative efficacy. And I'd like to explain what that means. If you had the vaccine, it's damaged the immune system. And now people are more likely to contract variants of this COVID-19 virus, or I shouldn't say COVID-19, that is a variant. We should call it a SARS-CoV-2 virus. The new variants now, we're more likely to catch this virus if you've had the vaccine. So we're seeing negative efficacy, not positive efficacy. In other words, we're not seeing a benefit to these. So I'd like to set the record straight on that based upon the current science. There was also talk about natural immunity versus vaccine immunity. And we are seeing now myself, I had the SARS-CoV-2 virus and most likely the Delta variant. And when I had my blood work taken, not only does my T-detect cell come up positive, which means I have long-lasting immunity, not just a short-term immunity from the vaccine. Now we know because of boosters, right? It isn't a long-term immunity, it's a short-term immunity, or else we wouldn't require these boosters. But the natural immunity is far superior, as the evidence is beginning to demonstrate. Cloth masks. CDC has just changed their opinion, and I think just this week you'll see in all the major news networks, it's not just a conspiracy theory. Conspiracy theories are only conspiracy theories until they're proven true, and then they're just a conspiracy. But the cloth masks don't work. They just don't work. This is a disease that's spread by aerosols, not by large droplets. And then we may have an argument that maybe we should, as physicians, we should all be wearing N95 masks. And I don't think that I would say very few people in this room even know what N95 means. N95 means the N stands for non-oil. If it gets wet, it's an ineffective mask. If it's not fit properly, it's ineffective. 95 means that the masks are tested for particles that are 0.3 microns or larger. It can stop 95% of those. But still, the holes in that mask are large enough to let things smaller than 0.3 microns through, like this virus, this SARS-CoV-2 virus, which is 0.1 microns. So this is an ineffective way to stop a pandemic, to put on these masks. Not by my opinion, but based upon the science. And then telling people to put on a cloth mask when we know that an N95, and we've had this virus now for 2 years, over 2 years. Don't you think that the scientists who did the experiments to show that an N95 mask could stop 0.3, things that are 0.3 microns or larger, 95% of them, don't you think in 2 years we could have done a study to show what effectiveness, what percentage, not 95, of 0.1 micron virus would be for that mask? It will be something less than 95%, but perhaps it's an N30 mask when it comes to a virus, this particular virus, only 30% effective. And then if we tell people to put a mask on, a cloth mask, or even these N95 masks, which we know now are not 95% effective because the particle, the virus, is 0.1 microns, aren't we putting people in harm's way, thinking that they're protecting themselves, when actually they're putting themselves in harm's way? The part of the population that's most at risk, you're telling them, sew a mask together made out of your underwear, put it over your face, a piece of cloth, and you're going to protect yourself from virus. No, what we just did was we put them in harm's way. This wasn't initially part of my testimony, but I thought I should address those topics. I'd like to now address parts 1 and part 4 of this bill, which is requiring the masks and discrimination. I sit here before you today because I had to flee the state of Rhode Island. Because if I continued to practice, even though I had natural immunity and I was able to prove it in my serology, in my blood tests, and my antibodies were 4 times higher, typically, than those people who were vaccinated. Even though I could do that, and I went to seminary school at Trinity College of the Bible before I went to chiropractic school, and every one of these vaccines was either tested, its efficacy, or developed using aborted fetal cells, murdered children's cells. And I couldn't put that sin into my arm. But the state of Rhode Island didn't allow for a religious objection. So I had to leave a $500,000 practice with 11,500 patients that I took care of. It was worthless. When I went to go sell it, the practice, the people that evaluate practices told me it was worthless. Just sell your building and leave. And that's exactly what we did. We sold the building, we sold our home, and here we are. And I don't want to see that happen in this state, which is why I'm becoming active in politics. I never thought I'd be in politics, but here I sit, right? So requiring masks and discrimination on the basis of COVID-19 is the reason why I sit here before you in the state of New Hampshire, trying to keep this the live free and die state, to keep liberty in a place of democracy in a democratic republic. I'd like to now address, so if you want to see if physicians will leave with healthcare providers, how they're gonna respond when they're forced, you're looking at one.
Before you go on to that point, you'd asked
Yes.
for 5 minutes, and I'm going to, you've gone past that. I'm going to ask you now to summarize, because we've got a number of people who wish to speak.
I understand. Immunity passports and requiring documentation. 80 years ago in Germany, we were asked, where are your papers? It would be an absolute shame to walk into a place of business and be asked to be shown your papers, particularly because the heritage of my family goes back to Germany and Russia. And I will not allow people walking into a place of business to be asked, show me the papers. So to summarize, this bill on all four parts protects the freedom of New Hampshire, the people of New Hampshire. It protects their health, and it protects the livelihood of the people who live here. I thank you for your time.
Would you take any questions from the committee?
I would be glad to.
Any questions? Do you have any written testimony?
This is the first time I've ever been in a state house building, so no, I didn't know to prepare a written testimony.
You don't have to. Do we have a
Okay.
The chair recognizes Representative Folsom.
If there's several people that would like some of the information that you shared and the description and the definition of the masks, would you please write up what you talked about today and any other thoughts that you have that you weren't able to finish, and send them in if you need help on how to do that? We would be glad to do that during the break.
That would be great. I would be glad to do that for you.
Thank you.
Thank you so much for coming, and my regards to Dr. Palmer.
Thank you very much. I'm sure he's not rolling over in his grave because of your comment.
Thank you. Chair recognizes Pam DiNapoli. I cannot read this, but I said enough, close enough. Help me get it right.
You got it right.
Wow.
Thank you. My name is Pam DiNapoli, and I am the current Executive Director of the New Hampshire Nurses Association, and I'm a nurse. I submitted my written testimony digitally, and so I'll just summarize a few things right now. You've heard the narrative over the last couple weeks about vaccines and masks and mandates and opposing and support, so I'm just going to talk about two key points. We still have a pandemic. The pandemic is still raging. You're hearing about fewer cases being hospitalized, but that doesn't mean that they're being discharged from hospitalization. So the beds are still at capacity. So we're concerned about that. And further restricting the use of proven interventions such as vaccinations, masking, and social distancing, including staying home when you're sick, to decrease the spread of COVID will prolong the pandemic and result in a continuing strain on healthcare resources, both human resources and capacity resources. And it will continue the spread of preventable illness and death. The OSHA General Duty Standard says it requires employers to provide a work environment that is free from recognized hazards that are causing or likely to cause death or serious physical harm. By prohibiting employers and places of public accommodation from adopting mandates that would otherwise protect employees from transmission of COVID-19 has the potential to cause death and serious physical harm to vulnerable populations requiring such protections, including those unvaccinated. At the end of the day, we all want employees and those that they serve to be treated fairly. That means equal protection provided by some mandates. The recent Supreme Court ruling continues vaccine mandates for healthcare workers, which is the right thing to do. Further protections that private employers can implement has the potential to stem the trickle-down transmission effect as a result of individuals objecting to practice best evidence policies. If everyone is to be treated fairly, then everyone must do their part. Discrimination on the basis of vaccination status is a two-way street. The choice to be unvaccinated in the workplace per CDC guidelines discriminates against vulnerable and immunocompromised, and this is not the right thing to do for the public's health. The New Hampshire Nurses Association urges you to oppose HB 1224, continue to allow employers and educational institutions the right to establish requirements for their own employees to protect the health and safety of those same individuals and all who utilize their services.
Thank you in advance.
Any questions? Representative Acton.
Thank you, Mr. Chair, and thank you for taking my question. Would you agree that there should be a different standard for medical facilities and with private employers? For instance, say truck drivers who are in the vehicle themselves all day long, who are now being barred from going into Canada, or other workplaces where there may be some exposure, but nothing like a healthcare facility where people are in close contact all day with people who have COVID and so forth. Would you agree that there should be a separate standard for those two bodies?
Well, I think it all depends on your work environment and where you work. So if I'm a truck driver and I'm in my cab and I get out and I pump gas and I go in and I pay for the gas, and that person in the store that doesn't have a mask, is not vaccinated, comes into contact, and then it trickles down. So that's the way viruses work, is that the more exposure, the more the virus expands. So I think everyone needs to be protected, the level of protection. So if I'm a healthcare worker, I want full PPE when I'm taking care of a patient. If I'm a truck driver, I may just want to wear a mask when I go into the store. So in terms of a standard, it definitely is leveled, but everyone should be protected.
Thank you.
Representative Leon.
Thank you, Mr. Chairman, and thank you for taking the question. It seems that you're very knowledgeable about this, so I'm hoping I can ask you a more detailed question. Do you know of any studies that show that the mask protects anybody other than the wearer outside of a healthcare setting?
I couldn't quote you a study, but I've read studies, yes.
If you could forward those to me, I've evaluated them before. I'd appreciate that. Thank you. And follow-up?
Follow-up.
And follow-up would be, are you aware that even with the vaccine, people are able to transmit COVID so that it does not stop it in its tracks?
Right.
And the main benefit is to reduce hospitalizations, which is another personal benefit?
Right.
Thank you.
Representative Weber.
Thank you, Mr. Chairman, and thank you for taking my question. Thank you for being here today. And isn't the reduction of hospitalizations a benefit not only to people who are not hospitalized with COVID, but also a benefit to everybody who has a car accident, a heart attack, a stroke, cancer surgery, that currently needs hospital space but is not able to get it?
That's exactly right. Or the person who has pain in their elbow and is putting off getting their elbow surgery so that they're not able to exercise. I mean, the capacity issue is more than just not enough beds for COVID patients. It's not enough beds for people to protect their own health or get the treatment that they need.
Thank you.
Representative DeLamus had your hand up.
Thank you, Mr. Chairman. And thank you for taking my question. As we heard from the doctor prior, considering the evidence, well, first of all, do you believe that new information, as we continue to examine this disease, should be considered when establishing mandates and usurping people's freedoms?
Well, I think that answers your own question. As we continue to get evidence, everything's going to evolve. So we need to start at the place of the most protection, and as the evidence becomes more clear, then we change, is like what we have seen with this virus so far. So I think that we all have to continue to be knowledgeable and read the evidence and stay protected, especially those who are vulnerable or being taken care of because of their vulnerabilities.
Follow up.
Thank you. Thank you. And considering the evidence, believe it or not, I used to sell filters. And some of the filtration systems that I dealt with actually were very effective because they used a static electricity to capture particles. And the microns that the doctor was referring to, very important. And if he is correct, and I believe he is, that the size of the virus itself is a 0.1 micron, which is actually rather large.
Turn it into a question.
Well, would you believe that, well, considering the evidence, how effective do you really believe the masks are if they're allowing particles to get through? If they're only filtering to, you know, like a 0.3 and the micron's 0.1, you're able to pass aerosol through the masks, in and out. And aren't the masks originally designed to protect the wearer and not the person who the wearer is speaking to?
Well, personally, I'll continue to wear a mask until I have evidence that I don't need to.
Thank you.
Given the change in protocols that we first recently heard from Sweden and then Denmark and then the United Kingdom a couple days ago, do you believe that evidence is coming?
I think so. I mean, I think the scientists are definitely working on it.
Would you believe there's at least two variables as to why? One is science is ever evolving as new information happens. And secondly, it seems that the pandemic is evolving from the original one to Delta to Omicron to, I guess, son of Omicron. There are more Greek letters, but apparently this is just a variant of the variant. So given, do you know that given this evolution of both scientific knowledge and events, we shouldn't be surprised that we will be given different suggestions regarding masks? Don't ask me to repeat that.
I think that if we've learned anything from this disease is that it's evolving and that we have to continue to look at the evidence and I guess continue to try to prevent preventable illness and death.
Thank you. Any other questions? Representative Gay, one question. Representative, I'll choose. Representative Gay, one question.
Thank you. Have you studied the clinical trials of hydroxychloroquine, ivermectin, and in particular the study in Argentina of 800 healthcare workers who were divided into placebo group and the group that got ivermectin, but it was double blind, so they didn't know what they got. Are you aware that the 200 people who got the placebo got sick, 58% of them got sick, and of the 600 who got the ivermectin, none of them got sick. It was prophylactic. I've read a lot of the ivermectin studies, yes, and I know a lot of them have been discredited. So what we want to look at is the meta-analyses, which looks at all of the data together, because 800 is a small study. So we put all the data together into what they call a meta-analyses, and 15% of the data in the largest meta-analysis study was discredited. So again, ivermectin, like masks, is something that we're going to continue to look at, but not use.
Okay,
No, not
we're
use.
straying from the bill here. Please keep your questions on the bill. Ivermectin is not on the bill. Representative Kofold.
Thank you, Mr. Chairman, and thank you for taking my question. So we're often called upon to balance the rights of one group or party against the rights of another. Mm-hmm. And one example would be a lot of people have a concern that they don't want to be offended by certain speech, and we have to balance that against the constitutional right to free speech. So I guess my question is, do you acknowledge that there are two competing sets of rights here? One is the right to medical self-determination, and then the other is, I would not call it a right, but your perceived right, or what I think is a right that you're perceiving, to live in a germ-free environment or as safe as possible environment.
As I understand this bill, it prohibits mandates. So that means that I don't have the right to then mandate something for the protection of my own employees. So I think, yes, everything is balancing, but the idea to prohibit mandates doesn't give us the flexibility that we need.
Thank you so much for your testimony.
Thank you.
Chair recognizes Mark Rossetti, who supports the bill.
Howdy, folks.
Good morning.
Ooh. My name is Mark Rossetti, and I'm just a regular old guy from the street. I do a lot of study on this. And with regards to this mandate, even this word mandate, I don't find it in the state constitution, and I don't find it in the federal constitution. I find mandates are despicable. This is a republic. It is about the individual. We don't need a nanny state federal government telling everybody that their herd immunity or their own immunity is no good, and teaching everybody nationwide and around the world that their immunity means nothing unless we want to keep on jabbing you with a needle. The choice of the people has been taken away. I've got a very close relative, or had a very close relative. He was a school teacher in Massachusetts. He ran in the marathons, never a smoker, a drinker, a partier, worked out every day. Believed in this COVID thing and went and got the vaccine. 3 days later, he was dead. It's a little too much to take. I know many people that have lost their jobs over this. You've got to choose whether you're going to put a needle in your arm or keep your job. I know several in New Hampshire. That's wrong. That's not right. When anybody does anything that's wrong against you, that's an abuse of your rights. For thousands of years, we've had herd immunity. Who ever thought of telling people they didn't have a choice about what to do? Ever. This is my body. You want to give me a shot, you better do it with lead because you're not doing it with a needle. Ever. There's been no FDA approval of the COVID vaccines that we've gotten until just last week. There's been no study of a year, 2 years, 3 years, 5 years, or 10 years. And we're ready to mandate people and tell them, show me your papers. And then we really need to look at what's in the vaccines. Has anybody here ever heard of graphene oxide? Besides baby fetal parts being in these vaccines, which has been proven, graphene oxide is in every one of these vaccines. Graphene oxide gets in your system and it creates like its own little wiring system. And 5G can be used to control it. Study it. The CDC has been proven time after time to be full of lies. And you know, early care, I got the COVID real bad the beginning of last year, and I had ivermectin in my cabinet. I couldn't breathe the second day. I was ready to go to the hospital. The doctor said, no, 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 don't show up. What's going on? Well, if you've got that, we don't want you bringing it here. That was CMC in Manchester, New Hampshire. I won't say the doctor's name. Early care worked for me. I had ivermectin at home. So let's go over these the things in this bill. Prohibits state or local government agencies from requiring masks. I don't need any nanny government telling me whether I should wear a mask or not. I said that before. If you wanna put a fence up in your yard to cause mosquitoes from not crossing your fence, it's the same thing as wearing these masks. You can't put a fence up with holes that big in it and expect mosquitoes not to get through. It's the same thing. Secondly, people that are getting these shots are the ones that are losing their herd immunity and they're shedding to other people and giving other people the virus. That's a proven fact now. But back to this law, prohibits state and government agencies from issuing immunity passports or standardized documentation. This government we have, especially the federal one, cares not about the states. We have 50 states, and there would be no federal government if we didn't have those 50 states. So they're turning around now, and it's just like when they do the, when they come to your house and do the census.
Mr. Rossetti, we've got a lot of people testifying.
I'm almost
and
done.
I appreciate that. Thank you, sir.
Okay? When they do the census, they collect a lot of information. For a long time, people in state governments have been against the government collecting that information. When they document you on this, they put you into a bank and they have all your medical information. As far as I know, socialists love having the medical system in their hands. And finally, somebody said it before me, show your papers. I'm not showing papers to anybody. Whether I have a vaccine or not is nobody else's business. HIPAA law covers that. And I don't think any state, anywhere, should be mandating that people have to have a vaccine or lose their job or can come into this public place or restaurant. That is totally against the freedom that America was built upon. If anybody's got questions, I'll gladly take them. I know I'm a little scary looking, but I won't harm anybody.
The only thing that's scary, sir, is I envy your head of hair. Any questions? I have a question. While I certainly understand it's my business if I get sick, what about the idea that if I'm a carrier, other people get sick because of me? And I have a responsibility to them unless I choose to live way up north in the woods and never have contact with anybody else. There was a question in there, I forget what it was, but what do you think about that?
Well, if you're sick, you shouldn't be going near other people. If we look at the R naught factor, okay, the R naught factor is on every you get the measles, the mumps, this, that, or the other. They've all got an R naught factor. The R naught factor for COVID is 2.4. For the measles, it's 18. So when a kid has the measles, we don't shut down the street. We don't tell everybody you can't go near Joe's house because Joe's son's got the measles. In other words, if you're sick, protect others, put a mask on. But don't make me have to wear a mask because you're a jerk. So, I'm just, like I said, I'm just a straight guy from the street, but come on here, we got to get serious. This comes down to common sense. The proof is turning around now. When England turns around and says, stop this with the COVID and the vax and all this stuff, and many other countries are doing this, when we look at India, and 5% of the population's got COVID.
You've answered my question. You've
Okay.
answered my question. One question from Representative Knurk.
Thank you. I was curious that you made a comment about the Constitution earlier and that there are no mandates stated in the Constitution, but are you familiar with the fact that in Part 1, Article 3 of the New Hampshire Constitution, that it says when men enter into a state of society, they surrender up some of their natural rights to that society in order to ensure the protection of others? This is a bit of a follow-on to our chair's question. So would you agree that there is recognition in the New Hampshire State Constitution that we do not have complete liberty, but we have to give up some for the protection of others?
Well, yeah, this is why we have resolutions instead of mandates. This is why we suggest to people to use their common sense. If you're sick, wear a mask. Don't go out in public. Don't be kissing and hugging everybody. If you're not, don't. So to mandate something is a government putting down an edict. That causes wars.
One follow-up.
Do we not mandate that you cannot drink excessively and then go out and drive for the protection of others?
Well, there you go. There's the common sense thing. If I'm going to go out and drink excessively and get in a vehicle and be blacked out and run others over, that's my fault. That's on me.
It's also against the law.
Well, it is against the law. I agree with you 100%. But I don't see the word mandate in the alcohol laws.
Thank you, Mr. Rossetti.
Thank you very much.
Excuse me, there was a hand up before I said that. So Representative Leon.
Thank you, Mr. Chairman, and thank you for being here and discussing all of these. I know that our Constitution does talk about those trade-offs, but do you, knowing that even if you're vaccinated, you can still spread COVID, do you think that forcing someone to be vaccinated to protect others when those who are vaccinated can be carriers would fall under that requirement?
I don't think anybody should be forced. At all. At all. I think it should be suggested to them. I think that's up to the patient-doctor relationship. And I'm not going to go into it, but doctors have been bought off. And all you have to do is study it to find out they make a certain amount of money for a COVID case, certain amount of money for respirators, certain amount of money for I can't.
Sorry, you answered my question. I really appreciate that.
You've answered the questions. Thank you so much.
Okay, thank you very much.
And now, the troika of Abby Rogers and Marie Marconi, and making her very first appearance as you're a 3L, are you? I am. Intern, Janice Emery. And it was suggested we be nice to her because this is her first time, and I say this is what our committee excels in, is being nice. So welcome.
Good morning, members of the committee, Chairman Pearson. My name is Abby Rogers. I'm joined today by Janice Emery, the our extern from UNH Law, and Anne-Marie McCary, who's the section chief from the Division of Public Health Services. Division of Public Health Services. We are here today to express our concerns, serious concerns in opposition to HB 1224. We won't repeat what others have said before us, but would like to comment on the bill and make some points about our areas of concern. So I'm going to turn the mic over to Anne-Marie McCary.
Good morning, Chairman Pearson and members of the committee. For the record, my name is Anne-Marie McCary. I'm the Immunization Section Chief of the Department of Health and Human Services, Division of Public Health. I'll be providing some information on some of the more concerning parts of House Bill 1224. HB 1224, as written, does not clearly define places of public accommodation. It's unclear if HB 1224 would apply to nursing homes, hospitals, or any other medical facility where COVID vaccination requirements exist. The Americans with Disabilities Act define a public accommodation as a private entity that owns, operates, leases, or leases to a place of public accommodation. Places of public accommodation include a wide range of entities such as restaurants, hotels, theaters, doctors' offices, pharmacies, retail stores, museums, libraries, amusement parks, private schools, and daycare centers. While the department does not, at this time, have any intention of implementing schools or child care requirements for COVID, thank you so much. While the department does not have at this time any intention of implementing school or child care requirements for COVID-19 vaccination, the department is concerned that HB 1224 would circumvent the department's authority under 141C20A to implement future immunization requirements. There is too much uncertainty about COVID-19 to place a prohibition that would threaten the ability to make future public health decisions, such as those for school and child care entry. HB 1224 seeks to prohibit a state governmental agency from issuing a vaccine passport or standardized documentation for the purposes of certifying an individual's COVID-19 status to a third party or share any individual's vaccination record or similar health information. The department is obligated to issue vaccine records to individuals who were vaccinated at state-run clinics where the department served as the medical provider. The department also opposes 1224 as it's contrary to 141-C, which obligates the department to allow authorized users, such as primary care physicians, nurses, schools, and the child care agencies, to access the information in the New Hampshire Immunization Information System. The department is also obligated to issue immunization records to individuals who have their information entered into the NHIIS. Records can be obtained through written request or downloaded through the secure patient portal. This bill would prevent patients from accessing replacement immunization cards or electronic versions of their information. The department is also opposed to HB 1224 as the language, as written, is inconsistent with 141-C, paragraphs 2 and 3, which state the exemptions where proof of COVID vaccination may be required. Thank you very much for the opportunity to testify today.
Hi, Janice Emery, extern with DHHS. We just wanted to add that the department's goal here is really to balance public health with individual choice, and we're happy to take any questions.
You've done this before.
I have not, sir.
Wow. Thank you. I have a question for whomever wishes to try to answer it. You mentioned, and I think I've got this right, that this bill would do something negative to the department's authority. Is it not the case you have the authority we choose to give you? That you work for us? You are the executive folks to do what the legislature either instructs you to do or not do what we prohibit you to do. And your authority is derivative. Is that not correct?
Thank you for the question, Chairman Pearson. That is correct. RSA 141C was put into statute to protect public health and protect against communicable disease. So as is, according to the statute, that's our task. And if the legislature chooses to make amendments to 141C, we would have to abide by that. That's correct.
I think that's a kind of a scary truth, but I just wanted to nail it down.
Yes, that's correct. Thank
Representative Weber.
Thank you, Mr. Chairman, and thank you for being here today. As the token attorney on the committee, I welcome you. My question is, would enacting this statute repeal your authority to provide me with a replacement card for the vaccine that I accepted voluntarily at a state vaccine site when I lose the card, and it would prohibit my ability at my choice to share my decisions appropriately with whomever I chose to share it with if I happen to lose the little piece of cardboard that's currently in my purse?
Thank you very much for your question. We are concerned that this bill would potentially impact that ability to issue the cards, as this bill does state that prohibits state or local government agencies from issuing passports or similar standardized documentation of COVID-19 vaccination status.
Thank you.
Let me follow up on that question. If that means I choose to travel to another state where they have chosen, and I'm not in their legislature, they have chosen to require me to present a card, I'm over a barrel now, and I'm even frantically now searching to see if I still have my card. Would that not put me at a disadvantage and take away my choice to travel?
If a state, yes, thank you for the question. If a state required proof of vaccination to enter the state and you did not have a card, that you would be over a barrel.
Yep, I did find my card, but thank you for the answer. Any other questions? Representative Gay.
Thank you, Mr. Chair, and thank you very much. Would a couple of word changes in that paragraph number, Roman numeral 1, where it says they don't issue the passport, I'm guessing, and please tell me what you think, I'm guessing that the attempt in this paragraph is to say that you don't issue passports, but it doesn't prohibit you issuing proof. Because the real issue here, I think, and you please tell me what you think, is that they're trying to ban passports, that would be a requirement to go somewhere. That, to me, is a different issue. There's two issues here, I think.
Thank you for the question, Representative Gay. I would point you to page 2, paragraph 2, where there's a definition of, in the legislation of immunity passport, where it does say means vaccine passport, vaccine pass, or any standard documentation. Standard documentation would refer to the card that the CDC card that the state distributes, proof of vaccination. The department does not issue any sort of vaccine passport.
Thank you.
Any other questions? Anybody want to throw a nice softball to the new kid in town? What kind of law do you hope to practice?
I'm currently working on my health law and policy certificate, so I'm hoping to do something in that area of law. Thank you.
So we're going to get to know you.
That's the goal.
Okay. Thank you so much. Thanks for coming. And with that, I close the hearing on House Bill 1224. And we'll take about a 5-minute break to collect our thoughts before we move on to 1604. I would like to take credit. I had nothing to do with it, little to do with it.
How's this corner down here? This is called social work corner. I see that.
Yes?
Who was on the committee for the whole paper? And I know it's Bill King, myself, Gary Wood, and who was the other Republican? Hi there. How you doing? Good, good, good.
Everybody down somewhere.
Good. Must know something like that. Yeah, yeah.
That one was.
I wish I did.
Do you remember the other?
I love your tie. You're the greatest collector. Well, my wife gives me
Oh, this one, Stapleton.
Really?
Okay. Merchant, Stapleton, Layoff. Yes. Okay, okay. That was 1654. Yeah. First two numbers are right.
Dennis Acton to the front.
Okay, great, thank you. Yeah, oh, yeah, no problem, no problem. Yeah, no problem. Where did I just put that?
Oh, wow. Get some stuff.
How do you do, young fella? How are you?
Did you grab my, oh, you grabbed my paper. Yeah. I'm searching all over for it. I'm not done yet. There's more.
Is that the summary?
Is there anything else, Your Majesty?
I'll come up with something, like an almond croissant or something.
Okay. Yeah, these things I want too.
Well, I don't know. You know, I have, can I just look? Because I have two documents. One is like an executive summary. And then the plan. No changes in the plan since January 2019. I mean, there's been no rewrites. Do I need to replace what I have with this one now? Okay. Well, this is different. I don't have this.
Oh, yeah.
You know, in many ways, it would be, we now have current representation. It would be nice to demonstrate that we can now have.
Yeah, I'm gonna keep this, I'm gonna read that tonight.
You know, being able to show the
Right, no, that would be helpful.
is actually, I think, in many ways.
You're in that window where your A1C is high enough that you need to.
You know, I've got.
Yes. Well, I wrote a column about that.
Did you ever sleep? Honest to God, how do you write so many damn things? Yeah, God's sake.
And then maybe a couple of nights.
But you're up at 5 o'clock every day, right?
Yep.
I slept until 6 last Saturday.
Oh my God, it's outrageous. Okay, wow. So now if you get up at 5, what time are you going to bed?
Well, I'd love to get to bed at 9. I occasionally get to bed at, I usually get to bed at 10. But sometimes it's after that. Sometimes it's got too much to do.
If you can report the statistics for Roxbury population 200, you ought to be able to report the identified statistics.
Unless you just passed it out.
That's a brand new one. Oh, you already have it.
If she sent it, she usually sends it to the whole. I can double check it.
Well, actually, I don't think we've done probably, there are too many steps.
But I am the child of a polio survivor. I'm a child of a polio survivor. There weren't a lot when I was very little. I went and got it.
Hi. The last
Triumvirate. Thank you.
Yes, Representative Wetter's same question. We had a
Two minds, one
we
thought.
had a computer issue, so I'm going to edit it and send it electronically if that's okay. Okay, perfect. All right, thanks so much.
Well. I was gonna find somebody to tell me how to get my scent section.
You took that sheet back again too, haven't you?
When I go to scent, you see what's that? My wife's name. Gosh, she's not. I'll have to go to see Sue Forster. I said maybe I could go see Lindsay. Oh yeah, they've helped me before. Hi, how are you?
Hi. Oh, okay, thank you very much, yes.
How are you doing? So you've got a new team approach to all this. The team approach, I got your memo about. So you're the dirty kid, is that right? I gotta tell you.
Yes.
Are you? That's gotta be a frustrating. That's gotta be a frustrating role.
Oh, the no patient left alone thing? Okay, that was.
Hey, I gotta tell you. Susan Passion is the greatest person.
Kim, okay.
She's so
yeah.
unbelievably helpful.
Let me find that.
Use my brain,
I don't
I
know
swear
if
to
I
God.
wrote them down, but I will.
No, we've heard it, but you haven't acted. We didn't want to push for it because the numbers didn't look good yesterday.
It was bill number 1439.
All right, thank you.
I do not have the names written down. All I knew is that you were going to do something and then people just started gabbing. Oh, it was. Okay. I guess I didn't catch that. I thought it was just one of those. Thank you. Okay. Those are the early bills? Can I have that list?
Okay. When did we hear it?
Like the last hearing was 1:31
Yesterday.
No, that's not right, I'm sorry. Well, no, 1:24, I'm sorry.
Okay, tell me the number of the bill again.
Oh, good, you do. I missed the fact that it was an actual subcommittee, so I didn't catch that and write it in. 1642.
What about trying to dismantle
16. Okay, this is the first time I know about it.
Do we not have a bill 1495 fiscal
greater
note?
transparency, how to ensure the state's maximizing its savings. And I don't know whether farmers behind it or what the, I don't know. It's coming on the left.
I added one to this
That
list.
happened last Friday.
Oh, okay, so it's not our bill. Okay. Yeah.
What number?
Okay.
And that one, part two, that
Mhm.
was repealing something as of January 1st, was an error by OLS, so they're removing that.
1495 is being rewritten.
No,
Oh.
there was just a little part added to it that's not supposed to be there, so that part's just gonna.
Okay, but it's not an early bill, even though it has a fiscal note?
Yes.
Okay. Okay.
And the one that I was freaking out about that had a financial impact was actually, we got a copy in our packet because this was last minute,
Remember that.
but it didn't exist.
Remember that.
Yes.
Okay, so this now, everybody agrees, these bills that are not crossed out have to be done by the end.
Yes, these bills here. I added this one.
1662. Restoration of the Book of Common Prayer to England after the Commonwealth was put down and the monarchy was restored, 1662. That's how I remember this.
Not me. You put down 1662 was an early bill? That's the IT security bill?
Privacy bill solid.
Okay, so 1662 is an early bill then?
Yes, it is.
Okay. Okay. Yeah.
Did the sign up for the previous bill get collected already? I just want to, sign it. Thank you.
Free ITL and early bill, is that the end of the bill? Yeah, they're not in.
Yes.
Not
Right, it goes on to the consent calendar for the first, yeah.
And then that's it.
That's it. We don't have to worry about it going to a second committee or anything. It's done. Well, as long as it doesn't get pulled off consent but I don't think that's gonna happen at this point.
Jim, I hate to tell you, this is yesterday's coffee. You know, it's amazing. That chair is really low, isn't it?
Open the hearing on House Bill 1604 FN, including state medical facilities
you're a
in the
good guy.
statute providing medical freedom in immunizations, and our own Representative Cushman as principal or prime sponsor.
Thank you, Mr. Chairman, and thank you, members of the committee. I'll just state it anyway. My name is Representative Leah Cushman, and I serve on this committee. Also a registered nurse, and I bring you this bill, HB 1604 FN. This bill goes back into HB 220 that was passed and signed into law last legislative session, and just repeals an exception for freedom in immunizations for state health care facilities. There was an exception that was added, I believe, during the committee of conference, and the bill as we passed it out of this committee did not have that exception. And so I'm just hoping to remove that, and basically, I don't believe that private employers should be able to hold livelihood over employees' heads for having their immune systems unadulterated. And on top of that, we have a healthcare workforce shortage. And you may have heard a lobbyist from the Association of Counties tell us that they only lost 10 nurses in the county nursing homes. And I have heard from far more than 10 that had a very difficult time either securing an exemption or just chose not to fight and just left. So I will say that I see the county nursing home shifts being an agency nurse, and they are constantly running short, and you know, they had a shortage before, and increasing that shortage even by 10 nurses has a significant impact. Everywhere is hurting for staff, but especially our county nursing homes. They don't pay as well to begin with. You know, 10 nurses is a lot. You know, one unit is typically run by 1 or 2 nurses, and you do the math. You know, and my understanding, though, is that, you know, we have exemptions, but the process has become very cumbersome. And to speak to Representative Folsom's question, there are questions for religious exemptions, such as, have you received any vaccines before? What makes this vaccine different? Can you describe how your religious beliefs impact other aspects of your life? Sometimes they're almost set up, the questions, to be like a trap, to kind of, you know, I guess, just to make it very difficult for you to prove your sincerity in your belief. So at the end of the day, though, who suffers the most from losing staff? It's the patients and the remaining staff. When you're running short-staffed, you have, you know, a significant increase in workload, and we already have, you know, high workload as nurses and LNAs and MNAs, and I think just that the state needs to not condone this kind of treatment of people. We should be setting the standard. It's unethical to deny skilled, competent medical professionals employment and to deny patients and residents the staff needed to care for them based on their vaccination status. We have PPE. There are other ways to mitigate this, and now as the science is, you know, evolving, as Mr. Chairman said at the last meeting, last hearing, we understand that it's not 100% protective, and it's actually only about 43% protective. And those who get vaccinated can still have the virus. And there are nursing homes in New Hampshire that are permitting positively tested nurses and other staff to work, but they're not permitting unvaccinated staff to work. So, it just comes down to, in healthcare, we have the right of bodily autonomy. It's the nurse's job to ensure self-determination for patients. And I think that self-determination needs to be protected for everybody, including healthcare workers. They don't give that up just because they want to help people and care for people. They still have, their body to worry about and their health to consider, and their beliefs and their conscience. And there is moral distress when they're faced with these decisions. And moral distress is one of the leading reasons that healthcare workers leave the field. So the UK just changed their practices, and they're removing mandates for healthcare workers. And maybe last year they felt that it was, prudent, but now where it's being shown that even if you get vaccinated, you can still get it and transmit it, and that Omicron doesn't really respond to the vaccines as well as Delta and Alpha did. They've changed course in their decision making and will be repealing requirements for healthcare workers. And they also noted that part of that decision had to do with staff shortages. So I think New Hampshire should make the move to remove this exemption from the Medical Freedom in Immunizations Act and allow our state to hire nurses and other healthcare workers to work in our facilities regardless of whether they've received a vaccine or not.
Representative Knurk.
Thank you very much. And unfortunately, I have to ask the same question I asked you on the last bill, and that is, what do you perceive will be the implications given the Supreme Court decision that the CMS ruling regarding the requirement for vaccination for healthcare workers is constitutional, and our county nursing homes are funded primarily by Medicare and Medicaid? What do you perceive will be the problem when we violate that by passing this, and how will we plug the loss of revenue, whether you think we're going to increase the taxes that immensely in the state to pay for our health care?
Thank you for the question. So as I stated during the last hearing, and I know that this is a new hearing, so in speaking with the 10th Amendment Center and with legislators in Florida who passed legislation that also contradicts what the CMS rule is, they foresee no issues with the federal government continuing to certify and reimburse for Medicare and Medicaid services.
Follow-up.
Since that Supreme Court decision was handed down less than 3 weeks ago, would you not say that that's not been a sufficient time to find out what's going to really happen with that?
Yeah, I suppose that there could be a movement by the federal government against the state of Florida. So far, it doesn't seem like it's going to be an issue. And again, the 10th Amendment Center took the position that the state has more legal authority in a legislatively passed law and more legal standing than a federal rule, and that the federal government will work with us and will not withhold important funding for our hospitals and other healthcare facilities.
Representative Shapiro.
Thank you, Mr. Chairman, and thank you, Representative, for taking my question. And I hope you, Mr. Chairman, that you will indulge me a little bit as I meander towards my question here.
That would go completely against everything we always do.
Thank you for not making me an exception. Representative, are you familiar with the Glencliff home?
I am not, Representative.
Okay, so the Glencliff home is a New Hampshire-run nursing care facility for people with severe mental illness. It's an unusual situation. Most states do not have those, but in New Hampshire, along with New Hampshire Hospital, the state of New Hampshire also runs the Glencliff Home, which is up where Representative Folsom lives, in the very western part of the White Mountains. So my brother-in-law lived at the Glencliff Home for maybe 8 to 10 years until he passed away a year ago. He was severely mentally ill his whole adult life. Very smart guy, very funny guy, great athlete when he was young, but he had this terrible illness. And it led to terrible consequences with his physical health, and so he needed the care of a psychiatric nursing home, and he lived there for 10 years where they gave him fantastic care. Just as one example of the people who live there, my brother-in-law would not have been able to socially distance or wear a mask consistently because he was paranoid and had all different kinds of things going on in his head that even if he'd wanted to do those things, I don't think he could have done those things. So my point being is that he's an example of the type of very, very vulnerable people, both medically and psychiatrically, who live at the Glencliff Home. The Glencliff Home is one of the institutions that is included in this aspect of the bill that you would suggest repealing or changing the exception. I know from your testimony and from previous testimony that you don't think the vaccinations are that effective or as effective as some other people think they are, but you did say that they were 43% effective in terms of something, so I know that you agree that they are somewhat effective for some things. So my question is, don't you think people who are severely psychiatrically and medically impaired and can't really take care of themselves deserve the highest level of protection from the people who work with them that they could possibly have?
Thank you for the question, Representative. And yes, of course, I do believe that they should have protection insofar as it doesn't violate the rights of others, right? So currently, we have the ability to rapid test for COVID. And the idea that a vaccinated person is guaranteed to be protected has been shown to be false. I mean, we could have someone who is vaccinated but, is morbidly obese and has other compounding health issues, and they may not have any protection if they have a poor immune system to begin with. A healthy, young, unvaccinated person may be less likely to be infected and contagious than that vaccinated person. So there are so many variabilities in how effective a COVID vaccine can be in an individual. I don't think that it justifies a blanket requirement for healthcare professionals to be vaccinated in these settings. And again, we still always have the Federal Civil Rights Act of 1964, and no facility is, can guarantee a 100% vaccination rate because we do have medical and religious exemptions. But I think what the state of New Hampshire needs to do, and the reason that I want to bring this bill forward, is I think we need to step forward and say, we believe in the rights of the people to choose when it comes to this vaccine, and that includes our healthcare professionals.
Representative Folsom.
Thank you, Mr. Chairman, and thank you for taking my question. You may have the answer to this, I'm hoping you do. You mentioned rapid tests and that the unvaccinated come in and they could have a rapid test done every time they came to work. Knowing the number of breakout infections among people who have been vaccinated, do you know, is it standard practice to also do a rapid test every day on people who are vaccinated?
It depends on the facility. So different facilities have taken different approaches to that. Some require 3 times a week for everybody. Some require daily just for unvaccinated. Some don't require testing at all. So it depends on the facility, and there have been different approaches taken.
Thank you.
Representative Leon.
Thank you, Mr. Chairman, and thank you for taking the question. I know that the Supreme Court ruling has been stated as if it's all said and done, but are you aware that they just they stayed the preliminary injunction pending the disposition of the government's appeal in the 8th Circuit? And depending on what happens in the 8th Circuit, this will or will not be upheld. So we don't know the ultimate disposition of this case yet.
I heard some mumblings that something was going on with it, but I did not hear the details, so thank you.
Thank you.
Representative Woods.
Thank you, Mr. Chair, and thank you for taking my question. You mentioned the chilling effect on hiring staff for nursing homes if the mandate is in place. Would you believe that there are staff who will not work because the other staff is not vaccinated? In other words, I know this personally. A nurse has decided to withdraw from a nursing home because of if there is no mandate in place, she will feel unprotected, and therefore she has family who have heart transplant, and she just can't take that kind of risk. So there's a chilling effect on the other side too, that if there isn't sufficient vaccination, that there will be nurses leaving as well. Do you have any idea how big that component would be?
Thank you for the question. I don't know how big that component would be, but I do know that I have a list of over 1,000 healthcare workers who have reached out to me for help with dealing with mandates because they have been forced to leave their jobs, and overwhelmingly that's been the report from healthcare workers that I've received. However, even if this didn't pass, again, that employee can never be guaranteed a 100% vaccinated work environment. And that includes patients. You know, we can't force patients to be vaccinated. And, you know, it calls into question, I guess, you know, I would never deny treatment to a patient based on their vaccination status. And I just hope that that nurse wouldn't either.
Representative Gay.
Thank you, Mr. Chairman, and thank you, Representative. Setting aside the question of personal rights, which of course is important, but we're really concerned, I'm assuming that all of us are very concerned about protecting patients. And so do you think that we have far superior ways to protect patients, such as the staff using prophylactic treatments, such as with hydroxychloroquine and ivermectin, which have been proven to protect people from getting sick?
Thank you for the question. So there haven't been any, clinical trials comparing the efficacy of vaccination for prophylaxis versus hydroxychloroquine or ivermectin or a protocol of those. So I can't say that one is more effective than the other, but I can say that there are studies showing that ivermectin and hydroxychloroquine as part of preventive protocols do have some efficacy in preventing COVID.
Representative Merchant.
Thank you, Mr. Chairman. Also, thank you, Representative Cushman, for taking my question. As I look through the bill and look at line 3, I may have missed this in your testimony. It says medical freedom from immunizations, are we talking about all immunizations, including things to do with hepatitis A, hepatitis B, things to do with flu is a good example. I mean, there's many immunizations beyond COVID, and I think the broad breadth of this language is concerning because there's many times in which vaccinations and other capacities have been shown to be very effective and also very important to the safety of the patients in which the facility is treating. I think I want to get clarification on what you mean by immunizations.
Sure, thank you for the question. So the statute that this is repealing language from is specific to COVID-19 vaccination.
Yes, follow up.
Would it be possible then to, instead of saying immunization, be specific, it says COVID?
So it actually just repeals. So there's no language that's going to be inserted. It's repealing, it's section 2E, which basically says that.
Would you read it exactly, please?
Yes. So paragraph 2E says, apply to county nursing homes, the New Hampshire State Hospital, or any medical facility or provider operated by the state of New Hampshire, or any political subdivision identified in paragraph 1. It's saying that paragraph 1 shall not apply to those. And paragraph 1 says, every person has the natural, essential, and inherent right to bodily integrity, free from any threat or compulsion by government to accept an immunization. Accordingly, no person may be compelled to receive an immunization for COVID-19 in order to secure, receive, or access any public facility, any public benefit, or any public service from the state of New Hampshire or political subdivisions thereof.
Representative Merchant.
Thank you, Mr. Chairman. Also, Representative Cushman. I misread the bill, so I stand corrected on what I was trying to say. So I now understand it. Thank you.
Thank you for clarifying, everyone. Anyone else? Representative Snow.
Maybe this issue.
And your microphone friend.
Thank you. Why do I have to fight with these things all the time? I'm sorry, maybe this is all clarified in 141C, but this bill only seems to reference staff, not residents or patients in any facility. Is that the intention of the bill, or is the intention of the bill to only apply to staff? Because there's nothing in the bill that clarifies that.
So it doesn't specify, and as it's written now in statute, it also doesn't specify it, but the bill, the statute that it's in talks about public benefit or public service for, that are offered from the state of New Hampshire. So my assumption is that right now, the state of New Hampshire's nursing homes and other medical facilities are not prohibited from requiring patients to be vaccinated while this language is there. And when we repeal it, they will not be able to deny a public service or benefit to patients or employees of state medical facilities.
So in your mind, it does apply, excuse me.
Yes.
So in your mind, it does apply to both patients and staff?
Yes.
Even though it isn't specified?
Correct.
And is there any useful reason why it should be specified? No, she said no.
I would like it to apply to staff and patients, that they should have medical freedom in
Right.
immunizations.
Thank you.
Any other questions for the representative? Seeing none, thank you. And the chair recognizes James Monahan from the New Hampshire Association of Counties.
Thank you, Mr. Chairman. I'm Jim Monahan with the DuPont Group, and along with Kate Horrigan, we represent the New Hampshire Association of Counties. I'm here today on behalf of the association in opposition to House Bill 1604. As the sponsor bill indicated, this is a piece of legislation which would make changes to House Bill 220, which passed just a few months ago. That bill created the exemptions for a number of facilities, including the county nursing homes. And it's primarily on behalf of the county nursing homes that we are opposed to 1604 and hope to work with the committee to ensure that the exemption from state law as it applies to the county nursing homes stays in place. As you all know, as members of your county delegations, there are 11 county nursing homes in New Hampshire. They care for approximately 2,000 residents and employ approximately 4,000 staff at the county nursing homes. Among our problems, as articulated in the letter that we sent you today, is that the challenge associated with conflicting federal and state regulations on the nursing homes. I think the committee is very well versed in the the CMS provisions that requires rather rigid infection control, including vaccinations at the nursing homes, including the county nursing homes, as a requirement for reimbursement through Medicaid. That's the CMS rule that we've talked about. Our concern with eliminating the exemptions that exist today is that would put us in conflict with that, which raises a whole number of problems, including, which has been identified here, which is potentially putting the Medicaid match for the county nursing homes at risk. We have heard people suggest, don't worry about it. There's some organization in the state of Florida that is saying it's probably not going to be a problem. But in fact, we think it probably will be a problem, both in its actual execution as well as the financial steps that the county governments would have to take if those funds were at risk. We're talking a minute about how we're going to gather some other information for the committee, but I think one of the risks to be concerned about is whether or not there's a risk of those funds being not presented to the county governments, whether that would become an event on a gas fee that would require some sort of a notification of it being a financial event, which would put county revenues at risk. That would happen well before any sort of a denial of the match from the Centers for Medicare and Medicaid Services. And I should also add that prior to the CMS rule and the Supreme Court decision, a recent Supreme Court decision, House Bill 220 was enacted in such a fashion that it created the exemption for the nursing home for the county-owned nursing homes. And so, while a lot has evolved between now and then, it's a lot of work for the staffs at the nursing homes to comply with the federal regulations, and adding another potential interference with that with state statutes becomes rather problematic for the counties. I should also say, we've Kate and I have a weekly conversation with the county nursing home administrators, and we want to be as accurate as we possibly can with the committee with regard to the impact on employment. And so when we meet this week, I'm going to try to gather some additional information, but as the committee is probably well aware, the CMS guidelines have a phase 1 and a phase 2 component of it, and they're also it's a relatively new provision. So particularly after we were waiting for the Supreme Court to act, a couple of larger counties actually went ahead and adopted a more rigid vaccine. I want to be careful not to call it a mandate because, as we well know, there are medical and other exemptions under the guidelines. But at least 2, if not more, counties moved forward with the exemption prior to the go-live dates from the CMS rule. But those go-live dates would be February 4th, as we're interpreting them, would be February 14th for the first vaccine, and then the second dose would be on March 15th. So it's still an evolving situation for the counties. But what we do want to do is be able to report back to you after we meet with folks this Thursday more accurately what some of the numbers are with regard to folks that had their employment terminated as a consequence with non-conformance with the guidelines. And then one of the more challenging things to do would be get our arms around whether or not folks have moved on because of the mandate. We'll do our best on that, but I think it was observed by someone in this side of the room that what we'll miss in that part of the conversation, we'll try to gather for you, is how is the vaccine guidelines at a county nursing home helped with employee retention. And that may well be because it has reduced the instances of people calling out because of being sick, or people that want to work in a safer environment. That's not as easy a number to gather for you, but I think it's part of the consideration for the committee. We're going to try and do that. Mr. Chairman, I trust you're probably not going to act on this bill before Thursday. But Kate and I would, okay, thanks. But Kate and I will try to get information through the committee, through you, Mr. Chairman, with regard to some accuracy on the numbers. But I think the numbers that Kate reported to you last week seem very consistent with what we're hearing from the county nursing homes, particularly knowing that we have some live experience with 2 large nursing homes that implemented the guidelines back in November, December time period. So anyway, with that, I'm happy to answer any questions the committee may have.
I'll answer one of yours. We won't be executing on Thursday, but we must by next Tuesday. It's an early bill. Thank you. Representative Weber.
Thank you, and thank you for taking my question. I just needed a clarification because I was trying to make sure I understood which dates or which implementations related to the 2 larger nursing homes in New Hampshire and which were the CMC guidelines. Am I right in thinking it's February 14th and March 15th are the CMC guidelines for implementation?
CMS guidelines.
CMS, rather?
Yes. Kate's my fact checker on that, but she's here, yes.
Okay, and so the nursing homes that you referenced actually implemented those guidelines earlier, and they've been in place for some time, since the end of last year, is that correct?
They implemented a set of vaccine guidelines. I'm not sure if they're exactly the same as the CMS guidelines, but they are, has been represented to us, essentially the same.
And when did they implement those?
I can check on you for that, but I think it was in the November time period.
Okay, thank you.
Representative Kofold.
Thank you, Mr. Chairman, and thank you for taking my question. You mentioned data collection and that you were going to be looking at the benefits of having everybody vaccinated in terms of employee morale and employee retention and the ability to hire new employees. Will that data also include information about employees that have been lost because they don't want to be subject to a vaccine mandate?
Yeah, that's, as I said, that's the number we'll try to collect for you. To be honest, it will be as concise as we possibly can, but if somebody moved on to other employment and their exit interview didn't include information about vaccine, their hesitancy around the mandate, we wouldn't know that. So while we'll do our best to give you a sense of it, you know, it's not a scientific data collection that's underway.
Follow-up?
Thank you. And do you have any data with respect to the rates of COVID infection among staff, including among staff who are vaccinated versus non-vaccinated staff?
We might. If I can gather that information, I'll do my best to get it to you. And then I think the other piece of it is they try to determine, and I don't know how well they can determine if it was community spread or more likely from the facility.
One more.
Are you aware of any county nursing homes in New Hampshire segregating employees and patients based on their vaccination status? That is, having non-vaccinated employees working only with patients, with certain populations of patients, and vaccinated employees working with other vaccinated patients. Are you aware of any situation like that?
Yeah, I'm aware there were situations of that last fall when there was some pretty aggressive outbreaks in some of the more rural county nursing homes where they they did just that. They created a COVID ward and made some accommodations around that. But that was prior to the availability of the vaccines. So I don't know if that continues. But again, I will try to get an answer for you on that. I suspect that those provisions, that because the vast majority of the staff are complying with the guidelines, that the necessity of that they've moved beyond the necessity for that.
Thank you.
Representative Leon.
Thank you, Mr. Chairman, and thank you for taking the question. I know that the healthcare worker shortage is not just in New Hampshire and is around the country. And I'm sure you've heard that some states are allowing vaccinated employees who test positive to continue working through without a quarantine period. I would like to know if any of our county nursing homes are doing that policy or if they are considering that policy. Because if they do, I'd like to understand where they stand on that versus unvaccinated employees.
This is going to be a long meeting on Thursday with the nursing home administrators, but yeah, I don't know the answer to that. I can try to get an answer for you. But I should say, part of the concern we have with 1604 is that by eliminating the exemption, it creates a rather rigid policy, in that I think we all know, we've heard from all sides of the debate, it continues to be an evolving situation. There are periods where there needs to be more stringency, and others with perhaps in the future we might not need them. There's different guidelines around isolation and quarantine and things like that. And the problem with this bill in that environment is it takes that flexibility away from the nursing homes, from the professional staffs there. If you've talked to your county nursing homes and their administrators and their directors of nursing, you know they put a lot of work into infection control. They have to comply with standards that CMS sets that are followed on by surveys that take place at the nursing homes, and not having the flexibility to operate your facility in a way that complies with infection control and takes into account the safety of staff and residents is something that that flexibility and that ability of your nursing home administrators to keep their environment, their residents and staff safe is a problem with this type of state government mandate on a local facility.
Follow up.
It sounds to me like the reimbursement guidelines from CMS are actually having more of an impact on day-to-day, on the practice of our county nursing homes than our county commissioners are. Would that be a true statement? Or at least on these policies, the vaccine policies?
Well, with regard to the federal Medicaid reimbursement, of course, that's all dictated by the Social Security Act and CMS rules and regulations that unfortunately, or fortunately, depending on how you look at the county commissioners and you as delegation members are not in a position to formally make changes to.
One last follow-up.
One more.
And I'm not sure if you're aware that they simply stayed the injunction that Supreme Court hasn't ruled down finally. If they end up overturning this rule and that CMS had this authority, will people who have been vaccinated be able to unvaccinate themselves once the policy changes?
I'm not sure if it's a county commissioner decision, or I'm sorry to be flippant.
The Supreme Court, yeah.
So I'm not familiar with the procedures for unvaccination. So.
You'd make a lot of money if you did.
Mr. Monahan, I don't know if you know that my job as part of the county delegation in Rockingham County is overseeing the nursing home.
Mm-hmm.
And further, that I had a loved one in there for quite some time. So I'm very close to the situation,
Yep.
and therefore, my thought was, if we did our job well and interviewed well and hired well, and the person is evidencing that, in this case, he is keeping up with an ever-changing focus, would I not be encouraged to let our Rockingham County nursing home administrator, under the watchful eye of yours truly and a few others, get on with his job with the flexibility he needs?
Yes.
Yes, I believe that.
Yes. Yes, I believe that, and I appreciate the approach, Representative.
Thank you, sir. Representative Weber.
And following on to that question, would you also agree that it's very important to recognize that a nursing home serving Manchester and a nursing home serving Coos County may have very differing needs at varying times, and that those needs may change as we have seen them fluctuate astronomically during the course of this particular scourge.
Yes, I would believe that, and that, would contribute to the reason why we're opposed to House Bill 1604.
Any further questions of Mr. Monahan? Thank you very much, sir. And we will be looking forward to hearing what happened on Thursday before next Tuesday.
Thank you.
Joseph Caristi and Ellen Lapointe from DHHS. They have handouts, or there is a handout. They oppose the bill.
Good morning, Chairman and members of the committee. My name is Joe Caristi. I'm the Chief Financial Officer and Legislative Liaison for New Hampshire Hospital and Glencliff Home. And with me today is Ellen Lapointe, the Chief Operating Officer for New Hampshire Hospital. We are here to testify in opposition today against House Bill 1604. In our written testimony, I'll just briefly touch on a few of the key points of our concerns. So the first of which, as we understand the first sentence of the Medical Freedoms Act 220, it does not limit specifically to COVID-19, and so we do believe that House Bill 1604 would inhibit our ability to require other forms of vaccination as a condition of employment, and that is a fairly long-standing practice in the medical community for things like rubella, measles, etc. And so that is one of our primary concerns. Relative to the CMS COVID-19 vaccine mandate, as it currently stands, it is our understanding, and we've reviewed this with the Attorney General's office, that it is active, and so we are working towards adhering to it. The enforcement mechanism that CMS has indicated for the COVID-19 vaccine mandate for hospitals is through the accreditation process. So the surveyors and accreditors for hospitals and nursing homes bear the primary responsibility for enforcement. And what that really does is it creates challenges for healthcare facilities if they were to not be in compliance with the mandate. There's a progressive disciplinary process from an accreditation perspective that could put our accreditation at risk. And that is a significant concern of ours for a variety of reasons. So without accreditation, a lot of our operations and clinical workflows will be subject to a lot less regulation. There is also the concern that very few facilities are unaccredited, and there are a lot of healthcare workers who would likely not want to work in an unaccredited facility. So we do have some concern relative to the potential turnover if we were to be put into that situation. Again, that would be a progressive process. CMS has indicated they want to work with organizations at every effort to try to come into compliance with the mandate, but that is how we have interpreted the guidance that we have received up to this point. And then our last, I would say, significant point of concern is relative to the loss of CMS-related revenues should we not be able to comply with the COVID-19 vaccine mandate. So we did provide some fiscal information relative to what that could mean for New Hampshire Hospital and Glencliff Home. In thinking about that particular situation further, since we provided that financial information, commercial insurance revenues may also be at risk for healthcare facilities, as a lot of them require accreditation as a part of the contracting process. So that also is a concern of ours, and we anticipate that risk could ultimately result in something like New Hampshire Hospital and Glencliff Home having to be 100% general funded. So the relatively significant risk there for our organizations. And the last point, I also sort of wanted to thank Representative Shapiro for his comments relative to Glencliff Home and the populations that our two organizations serve. it is a very challenging population to work with from a infection control perspective, and we certainly feel we have an increased obligation to do everything we can to protect those individuals, especially the ones who are within our facilities on an involuntary basis. So with that, we would be happy to answer any questions that you may have, and thank you for the opportunity to speak.
Representative Merchant.
Thank you, Mr. Chairman, and also thank you for taking my question. I'm going back to my confusion before. I think I'm more confused than I was before. I thought I read the bill correctly. I'm not sure if I'm reading it. But if I go back and look at the actual medical freedom immunization 141C, 1A sort of brought this up. It says on the first line, every person has the natural, essential, and inherent right to bodily integrity, freedom from any threat or compulsion by government to accept immunization. So the way it's worded, and it goes on and talks about COVID, is there confusion, at least I'm confused, between that word immunization versus the next line that talks about COVID specifically. So in repealing this, so we talk about the potential to repeal all vaccinations because of the way that's worded in the statute. Therefore, I go back to my original thing about being confused. I'm now definitely confused.
Thank you for the question. I think that is certainly the concern that we are raising as an agency today, is that first sentence does not include any of the words COVID-19 or anything to that effect, and therefore repealing our exemption from the Medical Freedoms Act could potentially inhibit our ability to require other forms of vaccination for employment.
Representative Leon.
Thank you, Mr. Chairman, and thank you. Are you aware that the Attorney General has already ruled on the scope of this legislation, the law that's already passed, and that he has ruled that's been ruled that it only applies to COVID-19 and not to other immunizations?
I was not aware of that. Thank you.
You're welcome.
Representative Weber.
I was going to ask is if perhaps the ambiguity in that statute is not a lesson to us as a committee when we look at bills, to make sure that a statement of purpose clause is labeled as a statement of purpose clause, and then the actual statute becomes the actual statute.
I think
for us to keep in mind.
I think we would certainly agree with some additional clarity.
Thank you so much. Appreciate your testimony.
Of course, thank you very much.
Chair recognizes Lori Ortolano. I think I got it yesterday. Is it the same today?
Yes.
Good.
Okay, I'm going to be brief because it's lunchtime and I'm absolutely certain everyone's hungry. So I'm going to set my stopwatch. My name is Lori Ortolano. I'm from Nashua. I don't have written testimony, but I just wanted to make a few comments on this. I'm a citizen. I don't represent any medical community or have a medical background. You know, all of this type of legislation is driven by these immunization issues, by the devastation of this illness and the death toll that it has taken and the burden it's placed on hospitals. But I can't help but start to question whether our treatment protocols were really appropriate in addressing this. And I think we have to consider that when we look at this type of legislation. I mean, this is an inflammatory disease, and treating inflammation is something we've known how to do for years and years and years, and I'm starting to wonder why we didn't know how to do that for this one. I'm very concerned about data reporting. You know, I don't think we have great data reporting going on, and I think we need to do a better job with our data reporting so we can make decisions on these impacts. And one of the gentlemen here who spoke about, you know, people potentially in nursing homes that are going to quit because they don't want to be around people, staff members who are unvaccinated. Very legitimate point, but we need to have a sense of how many people that encompasses versus the ones who are just trying to maintain employment while having vaccine choice. I'm very concerned that just because we say the same thing over and over again doesn't make it right. You know, capitalism drives our system, and those with the most money can also can often dictate the message, and from that message, we can have a false sense of security and be misled. So we have to question more carefully what we're being told. And as a citizen, you just have to try and peel away at what you think is the right thing to do. I'm also very concerned about, and this only recently happened for me, the natural immunity issue. I was living in a bubble for a while because I actually didn't realize that people who had COVID and were employed in jobs still had to go be vaccinated. I didn't think that was true when I first heard it. I grew up, or when I had my children, one of my doctors had always said natural immunity is much better than immunization because of the way it goes through the nasal passages, the eyes and mouth, that it was better than a muscle injection. I just always thought that that was true. I was aware of it. And then all of a sudden, natural immunity didn't count anymore. And I've only for 2 months gone to our Board of Health meetings in Nashua. I've attended 4. And I've asked our doctors, two actual doctors, a pediatrician and a pulmonologist and a dentist sit on that board. And I asked them why we don't consider it anymore. And they won't answer that question. They just won't respond. So anytime I ask a question and I try to speak to them after the meeting, because, you know, public comment isn't about questions, it's only about comment. And that's fine, because that's what RSA 91A allows you, no problem. But informal discussions after to connect with them, I can't get answers to those questions. And if I can't get answers, it raises concerns with me that we're not looking at data appropriately. And, you know, life comes with risks. It just does. There's no guarantees. And I am very concerned that the younger population is being forced into something that isn't suitable for the younger population because we don't have enough data. You know, I get it for the older population. I really do. But these costs and the money we're not going to get from the federal government, maybe we need to think about the potential risks and costs associated with forcing something that we don't have a lot of history on and the impact of the costs of that to our state when we do these things. I'm just concerned. So I've done my almost 4 minutes, so I'm stopping.
Wow, thank you.
Thank you.
Does anybody wish to ask her a question? Seeing none, thank you so much.
Have a good lunch.
And then the final pink card from the New Hampshire Nurses Association, Pam DiNapoli.
Thank you for taking my testimony on this bill as well. I just want to preempt my statements by saying I was notified during my testimony that my digital testimony did not get to you, and some of my members said the same, so we'll be emailing it to you after this meeting. The second was, I just want to echo the comments that our understanding was that this applied to all of the immunizations. So in reading my comments, we're really talking about the term immunization, and again, what was said is hoping that that might be clarified. Anyway, in 2021, the Medical Freedom and Immunization Act became law. In signing the Medical Freedom Bill, Governor Sununu's press team announced, as long as he has said, Governor Sununu believes that private entities have the choice to require vaccination. Brandon Pratt, the governor's deputy communications director, told ABC News in a statement, "The simple fact remains that the safest thing one can do is get vaccinated as soon as possible to help increase the state's already high vaccination rates." By the nature of the business, it was logical then and now that county nursing homes, New Hampshire Hospital, and state-operated medical facilities were exempt from rules of the bill, being cared for by providers who have not been fully immunized as defined in CDC's annual guidelines, which include vaccines such as hepatitis B, influenza, pneumococcal pneumonia, measles, mumps, and rubella, among other vaccine-preventable diseases, puts these most vulnerable and sick residents at risk for a spread. Historically, healthcare institutions have established requirements for vaccines as conditions of employment. In recent years, there's been a move towards increasing vaccine exemptions. Unfortunately, the COVID-19 pandemic has exacerbated conflicting beliefs re individual freedom and public health and safety, fueled by misinformation about vaccines. Individual reasons for decisions not to vaccinate include the safety of a vaccination and/or its ingredients, religious or philosophical objections, fear of side effects and associated illness, and lack of urgency or priority, explained in part by the supposition that herd immunity will protect the unvaccinated from infection. If an unvaccinated person encounters another person that is infected with the virus, they too will become infected, regardless of herd immunity percentages. The legislation proposed in HB 1604 conflicts with healthcare providers' duty to protect self and others and may interfere with the ability of institutions to establish requirements to maintain health and safety. Effective protection of the public's health mandates that all individuals receive immunizations against vaccine-preventable diseases according to the best and most current evidence outlined by the CDC, the ACIP, and all healthcare personnel, including registered nurses, should be vaccinated according to these recommendations. Finally, as has already been noticed, the Supreme Court ruling upholding vaccine requirements in facilities that accept Medicare and Medicaid payments could further jeopardize the health and safety of all those involved, including and among other residents, healthcare providers, pharmacists, or housekeepers. The reduction or elimination of vaccine-preventable diseases is one of the greatest public health achievements in the United States. Current evidence and research illustrate that immunizations are essential to the primary prevention of disease from infancy through adulthood. The New Hampshire Nurses Association urges the committee to oppose HB 1604. Thank you in advance.
Thank you so much, and will you take questions?
I like doing the lunchtime questions.
I want to thank you so much for testifying. Before I let the committee go, I will close this hearing, but then I have a couple of questions for the committee. This ends the hearing on House Bill 1604, and the question I need to ask is, if there is anyone who wishes to work on an amendment, we will be execing this bill one way or the other on Tuesday. And it would be helpful to me in my preparation to know, are there people interested in this? You don't have to. You're thinking of bringing forth an amendment, perhaps.
If one is required,
One is, it's totally up to you, folks. Representative Weber.
I'm not volunteering for this, but I also have a question of the chair when you're finished with this particular issue.
Okay. Representative Merchant?
Question to the chair, I think, also is to clarify. I think there needs to be clarification because the opening statement really is not a statement. It's kind of woven into the statute itself. And I think if we go forward, we have to have some clarification on the intent of what it means by immunization in the opening line. And no, I'm not volunteering.
Representative Cushman?
Thank you, Mr. Chairman. So there was question about that when the bill was passed.
Hold up until he asked the question and he's, okay, now. Go ahead.
There was question on that when the bill was passed. There was a faction of the public that wanted it to apply to all vaccines, and there was a faction that wanted it applied to just COVID-19. And when it came down to the wire and the AG was asked his opinion on it, he said that because the second sentence starts with accordingly, that the implication is that it only applies to COVID-19 vaccines.
Okay, not asking for an amendment, I'm just asking, this is the time, if one person wants to work on it with others, everything goes out the door on this on the 8th. So I don't see anything. Representative Weber, you had a question of the chair.
It was actually the chair and others about 1439. Might I inquire about availability of the subcommittee for at a particular time?
Yes, you may. Thank you.
The subcommittee, as detailed by the chair and others, was myself, Representatives Leon, Gay, Kelsey, Cushman, Woods, Nutter-Upham, and McKay. And this is the bill relative to hospital visitation policies with a particular emphasis on end of life, but also throughout life. And I was wondering if I could schedule that at 8:30 on a Tuesday morning so that people would not have to make a special trip in to consider that. Does anybody object to that? Because I would do it not next Tuesday when we're under the gun with a lot of execs, and I think people might be preparing for that, but the next Tuesday, and I could then prepare calendar notices for that if that's okay. Hearing no objection.
I'm going to check with Representative Kelsey since she's out today, but
Okay, thank you. We've got a pretty good critical mass at this point, so.
I, as the clerk, have a request. If someone could substitute for the clerk during that meeting and take the notes.
The normal procedure on subcommittees is one of the members, and it may be the chair, but it may be another member, does take that. And the minute taking for subcommittees is very minimal. It's simply recording decisions. It's not recording, as you do, every single comment by every single person, which is a great relief to anybody doing that duty. But I will ensure that that's done, and the clerk may be at leisure.
So Representative Weber, perhaps after hearing from Representative Kelsey, who's not with us today, then you would take care of calendaring. Thank you so much. The other question I have to raise is on the first bill we heard, 1224, prime sponsor Representative Baldessaro, as presented by Representative Cushman, prohibiting employers and public space people from discriminating on vax status and several other things. Again, I'm not asking, and I'm not making anything except if there is an individual or a group who wishes to write an amendment to this bill too will go out the door on the 8th with or without you. So just inform me. Does it look like there's anybody who's going to do this?
Was this a question that we got the answer to? Because I marked two places, whether we were specifying which immunization.
That
Again.
would be a question to anybody in the room other than me, please.
Yeah. Did that get solved already?
In HB 1224?
Yes.
Yes.
Yes, that bill is specified, I believe, yes. That one is specific to COVID-19 vaccination.
So it looks like there isn't, but should someone on the drive home say, you want to write something wonderful and get a group together, just let me know, that's all, so I can plan my work. That looks like almost it. Representative Soloway.
Mr. Chairman, I have a piece of information that just arrived. May I inform the committee? I
Is
think
this
it's
late
pertinent.
breaking news?
It's important. I'm sorry?
Is it like late breaking news?
This is late breaking news. This is from my informant at the Cleveland Clinic. This is Dr. Jennifer Tabin, who says the vaccine mandates are being removed in the near future in Florida and Colorado. They're going to be removing the vaccine mandates and mask mandates. Essentially, the pandemic is considered over, and that will be going into effect toward the end of this month of February. If I may add to that, a week ago Friday, I informed my domestic partner, well, it's over. You can watch the numbers drop beginning today. The news media are in fact reporting that hospitalizations are way down for complex reasons, that deaths are going down, and we're probably seeing the end of Omicron. Currently, Omicron B is still out there. We don't know what that's going to be like, but it's very likely that we're now past the crisis, and that may affect our decisions on legislation. Thank you, Mr. Chairman.
This is why the chair kept these bills that are early bills as late as I could to see what happens. And since you are an epidemiologist, would you all buy lunch for us, given that great late-breaking news? One more announcement.
Thank you. Representative McKay received copies of the mental health 10-year plan and a supplement from DHHS. So when you come back from lunch, that's what's going to be sitting at your desk.
I had hoped to end by 12:15. I apologize for going over by 1 minute. I will see you at 1 o'clock. Representative Soloway, I don't recall your answer to that question. The question was, because you're an epidemiologist, would you be buying lunch for us? Yeah. I will accept that. Thank you.
I am sure the clerk should get hysterical, though.
clinician and a peer support specialist go out together, and sometimes they go with the police. The police will request we go with them, or vice versa. All right. Yeah, and,
Yes.
but anyway, it works very well. And, you know, basically the intent there is to develop a safety plan. Can we work out a safety plan? Have we put all the pieces in place to get that safety plan? Then you have a follow-up plan where the emergency
We
service.
We
where
could.
And you try to track, will they
Yeah, yeah.
follow up in 2 days, in the next day or 2 days?
I was showing this to Leah.
Because right now, it would be nice if you could instantly go right into treatment. You know, we've got waiting
18
lists.
more federal
And we-
agencies making vaccine religious objective lists, including 3 cabinet positions. The Secretary of Transportation has them, even. Department of Justice, Health, Human Services, Transportation, and Department of the Treasury.
Money, honey.
Tracking people with a religious exemption. Yeah, they're
Well,
building
you
a
know, the
data.
problem too is,
Yeah, they're building a data list of everyone who uses that as an
you know, it's
exemption
absolutely
for
true,
the
that's a tough
vaccine.
job, and it's a lot of turnover, a lot of burnout on it. Yeah. And I asked my son, what are you most scared of? You know, to some of these places, and I thought he was gonna say guns, you know what he said? Bed bugs.
Oh, yeah. But you know, there was fraud,
Well, he's a
financial
little
fraud
phobic about bed
involved.
bugs.
There's no financial fraud. Just keeping track of who we are for some purpose. So, yeah.
If you guys are willing to do it,
2 or 3 times access
Gary and I sit down
photos
with Erica
of Bassett House.
Mhm.
I believe the next day, right there in the ad on the side of my.
Oh, yeah.
Sorry.
Yeah.
Sorry.
What?
You know what, let's, sorry, no, we need to review this one more. I was thinking that this was the,
Oh,
this one is, let's make sure that.
is that one yours?
Oh.
Oh. It's a church one? Oh.
Yeah, there'd be ads for Bassett House.
Mhm.
Get your Bassett House. How do you know that?
Yeah.
Because I click those little things, they know about it.
Mhm.
And that doesn't scare me as much
Mhm.
as when somebody else was by and just happened to punch some things into my computer, and now ads for that person
Mhm.
here. What if they were crossing the line?
Yeah.
My God,
Yeah.
now accuses me.
I love going on Pinterest. It's a,
Oh, yeah.
you know, and so, but one day I had clicked on something on there, and the very next day on my Facebook page, one of the ads was for that same thing. It's like, my goodness gracious.
We're just reviewing the exact wording, but we probably have enough agreement on that. Gary has a copy and he's talked to his vendor.
I know what you're talking about. That's good.
Yes.
Okay, is that mine?
That could be yours. I had them all printed off by House Committee Services, so we have them.
So you guys are of the opinion that we can go ahead and.
We've got, 2 more bills, and then if we have some time, exec a couple more just to.
Do we have a time next week when we don't have your schedule?
Next Tuesday, there are no scheduled bills because we have to finish all the execs by then. And then we've got a list of bills that we haven't even heard yet, the rest of them. Just, I cannot believe how many bills. It's just crazy.
So here's the 1390. Now, the thing is, I need to proofread this, given that this bill is laced with so many errors with the wrong citations in the state law, the wrong citations in federal rules.
Yeah.
I'm going to go through this with a fine-tooth comb to be sure it is correct. But I think we can do, and I did send you the email from Paul Smith, and he said the proper strategy, since it's still in our hands, is to reconsider. Everybody votes yes to reconsider. We vote no on the OCPA that we previously did. Then we move the new
Oh,
amendment,
fun.
pass that.
That's at least 5 roll calls.
Yeah. And he said, no, it should not be an old bill amendment.
Well, I didn't think so.
So, but he wrote the book.
And then he said also, it has to go over to the Senate, and who knows what's gonna happen. So with that in mind, he could get better.
So the first motion is, we reopen the exec session on 1390.
And the first motion
The first motion
comes,
is reconsider. The second motion is no on OTPA. The third motion is,
Well, actually, yeah, we're reconsidering the OTPA with the previous amendment, that's right.
Right.
I mean, I'd all vote, I'll kind of construct it.
Yeah.
They will vote no, and then that means it's back on the table as only the original bill with the original amendment not passed. Then I will move this amendment, and then once that's passed.
then we do the new
Or
OTPA.
strand by strand, then I will, then I'll vote, I'll move OTPA with this one.
this new amendment.
And by that time, you've already.
That's only 4 roll calls.
I think I should get some award. I think I should get some award. Yeah, proof it, yeah.
Remember how we reconsidered because he was late and he woke up and voted the wrong way and we voted reconsider and we voted the right way? That was a moral issue.
And you know, the thing was is that I totally Bruce afterwards, I said, I took liberties and I put his vote in anyway, in case we didn't wake him up. So because I knew how he was gonna vote. But she said, no, you probably shouldn't do that. We should, you know.
What you shouldn't have done is tell her. But
Yeah, yeah.
Ollie, Ollie, and free. Flown in at great expense from right over there. Open the hearing on House Bill 1003, prohibiting healthcare providers from refusing to provide care or services based on patient vaccination status. Presenting her bill, the prime sponsor, Representative Cushman.
Thank you, Mr. Chairman, and thank you, members of the committee. My name is Representative Leah Cushman. I represent Hillsborough County District 2, Ware and Deering. And I'm bringing you this bill, House Bill 1003. This bill inserts language into the Residential Care and Health Facility Licensing Chapter. So it only applies to patients admitted to a facility, those facilities that we discussed on a previous bill. Would be nursing homes, hospitals, dialysis centers, day surgery centers. So anything that falls under that statute, 151. So the premise of the bill is we live in a culture of increasing hostility towards people who make a medical decision to not participate in vaccination. And I have mentioned previously that from my background as a nurse, I took my code of ethics seriously, and when I was told it's part of my responsibility to advocate for patient self-determination, that I took that wholeheartedly. The American Medical Association recommends not refusing care to patients who decline vaccination in a way that discriminates based on a class of people. They do encourage making adjustments in the manner of serving them if they feel it's necessary, such as having rooms set aside for unvaccinated or having them come in for visits at a certain time of day if they feel that that's necessary. So the conversation in the literature, medical ethics literature, has changed over the years since I graduated nursing school in 2014. During that time, medical ethicists were saying it's absolutely a doctor's duty to continue seeing unvaccinated patients, even in primary care settings, not only in emergency care. And now there's a shift in the culture of medicine to not only deny care to unvaccinated, but there is some interest in the effectiveness of using shaming and using fear as a means of encouraging vaccination. So there's been a real change in how these people are approached when it comes to healthcare. So for me, it's just another representation of how far medicine has fallen as a practice where doctors can refuse patient care based on a medical decision. People decline vaccinations for all kinds of reasons, religious, moral, ethical, or based on their assessment of benefit versus risk. We believe in informed consent, right? As healthcare providers, doctors and nurses are expected to ensure patients have informed consent, but how does that add up when we decide that their decision is unacceptable and say, well, if that's your decision, we can't treat you? That's not in really providing informed consent or acknowledging patient self-determination. So if an immunocompromised patient refuses to take an immunostimulator to reduce their risk of infection, would a doctor refuse them? Because they are at increased risk of infection and therefore at increased risk of passing on that infection. So if a doctor wouldn't do that, why would we refuse someone who doesn't take a vaccine? It's the same premise. How about morbidly obese patients who refuse to change their diet, or diabetics who don't take their insulin and end up with infected leg wounds that nurses have to care for daily, putting them at risk of MRSA and other antibiotic-resistant bacterial infections? You know, we have to get right up personal in our, sometimes get our faces in these things. And despite the damage to our backs and the risk of infection that we face, we don our PPE and we take care of those patients. We don't turn them away, and we take care of them with love and compassion. The bill just says you can't deny care based on vaccination status. It doesn't mean that if a patient is combative or, for other reasons that you would deny care, that you can't. If we had a robust alternative healthcare system in New Hampshire, I might say that this bill isn't necessary, but where we have a heavily corporate, monolithic healthcare system, especially where hospitals are concerned, and that's the area that this bill addresses, I think that it is needed. So I'm concerned about most nursing homes don't have any vaccine requirements and don't discriminate on vaccination status. I'm really concerned about hospitals. There have been some cases around the country. A 3-year-old was denied heart treatment because the parents were unvaccinated. That's just a headline, and that was actually in Europe. But an unvaccinated patient of a Boston hospital was denied a heart transplant because he wasn't vaccinated. And if you just search the internet, you'll find similar cases. And I have received reports from the general public of parents being let go from specialists that their children needed, from being dismissed from private practices based on vaccination status. And this bill doesn't apply to private practices. I think there is some more room for lateral movement for patients to shop around and find a different doctor. But I'm open to having that discussion if that's something the committee wants to include. So that's about it.
Thank you. Representative Weber.
Thank you, Mr. Chairman. Thank you very much, Representative Cushing, for taking my question. So you were talking about hospitals and access to hospitals, but as far as I know, the Department of Health and Human Services is involved in only one hospital, being the New Hampshire hospital. The other hospitals are all entities unto themselves, and while they may have to comply with certain department regulations, it's not the Department of Health and Human Services that's requiring anything. It would be the entity themselves. So how does this apply in those cases?
So this bill isn't just specific to the Department of Health and Human Services. It's to all medical facilities that are regulated by that statute It's 151.
I'm sorry, do I have the wrong bill? What bill are we on?
1003?
Ah, I have the wrong bill.
Okay.
My
Hold-
deepest
hold
apologies.
that
This is
thought.
what I get for being late to class, and my apologies. Thank you for the clarification. No
But hold
problem.
that thought, because you're
I
on
will
a
hold-
good roll
I
there.
will hold
Yeah.
that thought.
Okay, Representative Woods.
Thank you, Mr. Chair, and thanks for taking my question. Just a query about the rather broad-based inclusion. I'm trying to think of potential exceptions. Say an oncology service that has people who are really immunosuppressed, and then not to being able to say, well, no, in this facility we need to have everybody vaccinated to care for these particularly immunocompressed or compromised patients. Similarly, like two of my very close friends here in Concord have heart transplants, and they can't, even with vaccines, can't get their titers up. They have to be protected, and if they had open clinics without some regulation, that would be rather significant. Is there any exceptions for this in the way it doesn't look like there's any exception for anybody for anything?
So it just states that they can't discriminate, they can't deny care or services based on vaccination status. So they could still, if they wanted to, separate appointment times and have all the unvaccinated patients come at the end of the day, or only be seen on a certain day. They could still make policies like that if they wanted to. But again, currently there's still no guarantee even that the employees in that facility won't be vaccinated given the exemptions available.
Representative Knurk.
Thank you very much. Sort of as a follow-on, I appreciate and agree that we shouldn't be discriminating whether we're going to care for somebody. We still take care of people who have, are smokers and get lung cancer. We take care of them. The question is, sometimes there's medical issues. For example, you brought up heart transplants. And there's a number of factors that go into deciding who gets a heart, because we don't have enough of them, or liver transplants. If I remember right, we don't usually do liver transplants in people who continue to drink because we know it's just going to fail. So would it be reasonable to say something in the order of, based on a patient's vaccination status, comma, unless there are medical reasons to do so? Or that's kind of vague too. I can't figure out a good wording. But there are some times when this might possibly come in. I think it'd be rare in terms of a decision making for something that would be medical, though, not because you didn't like it because they didn't get vaccinated, but because of the increased medical risk or something along that ilk. I'm not sure how to word it. What's your thoughts on that one?
I'm open to discussing it. Like you, I don't see it. I see it being a really rare occurrence where that would be the only factor that would preclude a medical treatment or procedure from going forward. But I'd be open to discuss it, certainly.
Follow up.
I'll try to think back, but would you believe that back when we first had HIV, that was an issue because we faced it with things that were elective, like hardware removals from ankle fractures, and the concern of increased risk. And we spent a lot of time in the hospital trying to figure out how do we handle that situation. I'll try to think back to figure out how we worded some of these things and get back to you on it. I'll work with you on it.
And now
Thank
the
you.
chair calls on the honorable gentlelady from Cheshire County with a question on House Bill 1003.
Well, and I know it was on 1003 because Representative Knurk really asked the question that I was going to ask about those procedures where we deny for all kinds of different factors, and they may be obesity, they may be refusal to stop drinking, they may be, scarce medical resources, and you have to decide as ethically as possible how you are going to not only do no harm but do the most benefit. And so I think we were driving at the same thing. So I thank you for your willingness to consider that.
Representatives, excuse me, you may answer if you wish. Representative Cushman.
Oh, thank you. So my thought is that not being vaccinated in and of itself a year ago, when there was no vaccine, not being vaccinated wouldn't preclude somebody from obtaining a procedure, like a heart transplant or anything. So I personally don't think it's an acceptable reason to not, even elective procedures, to not go forward with them.
The Speaker of the House had me do a deep dive research on the issue of transplants. And would you believe that what I learned, among other things, was that there were many factors that would push an individual up or down on the transplant list, one of which would be the likelihood of survival of this individual in receiving the transplant versus that individual. And that would you then believe that it's not the only answer, but it's a valid answer in the question, that lack of vaccination status could be seen by some reasonable people as something that would push them down the list?
On a case-by-case basis, yes.
Okay, good.
I could see that.
That's it. Representative Soloway.
Thank you, Mr. Chairman. And Representative Cushman, thank you for taking my question. It's a two-part question. I do want to point out, however, that we have visitors in the gallery, and we are being on our best behavior for
We've
those
not done it
visitors.
this year, but we can try.
Are not practitioners and organizations already bound by their ethical systems?
I would assume that they are, but the ethics around how we treat unvaccinated people has changed a lot in the last year or two. So I've seen an increased tendency toward a new understanding of what the ethical way to treat them would be.
A quick follow-up?
Follow-up.
I was moved by your presentation of the numbers of diagnoses that might require this kind of protection. I thought that you did a really good job on that. But the way the bill is written, would this not open up the door to add a longer and longer list of diagnoses that require protection? We've seen this with other bills that we've dealt with in this session, in particular on the bill on migraines. Would we open up the door there to a long series of diagnoses? Would we not be opening up the same door here?
Thank you for your question. I didn't add a list of diagnoses. There's no language for that in the bill. It's just that there's a prohibition on refusal to provide care services based on vaccination status.
You could generalize it rather than just vaccine. You could come up with language on any pre-existing condition, da-da-da-da-da-da-da. Does that make sense?
Yeah, sure. I mean, I'd be open to discuss, a different way to word it. Sure.
Yeah. Thank you so much, Representative.
Before we continue, the chair wishes to reconsider a previous remark that perhaps was not worded well, that yes, we are on our best behavior, and this is something that this committee is noted for. And thank you for the look I got from a one-time second grade teacher that encouraged me to do this. Representative Leon.
Thank you, Mr. Chairman, and thank you for that clarification, and welcome. Thank you for joining us today. Thank you, Representative, for taking these questions, and I appreciate the other questions around denial of care. Would you be comfortable if this list of diagnoses that are excluded is written so that a patient with a disease that has a lot of immune compromise, say somebody that needs treatment in one of these oncology clinics, or needs to be seen by the transplant center, perhaps they already have a transplant, would you be comfortable with excluding those patients from care, even though the other patients with the same diagnosis have a more elevated risk? Sorry, I probably didn't word that clearly, I'm saying.
Can you ask again?
Okay. So, okay, I'm going to back up and rewind the tape. We're looking at some of these patient groups that are very vulnerable. And without treatment, whether those who, any of those patients without treatment may end up either much sicker or die. We're talking about the idea of protecting those patients who are vaccinated and potentially excluding the unvaccinated. Are you comfortable denying life-saving care to somebody simply because others with the same diagnosis might be at higher risk from COVID exposure?
Oh, no, I am not comfortable with that.
Thank you.
Thank you for the question.
Representative Snow. Well, we're halfway home. We've got the microphone in front of you. The next step.
Why is it I'm the only one that has trouble with these things? I can't.
We
figure
hide
that
it
out.
better,
I
Ken,
know,
we do.
I know. At the beginning of your testimony, you indicated this bill was really like the other bill we looked at that was really aimed at healthcare facilities, nursing homes, et cetera. And yet the wording of the bill says providers, which seems to indicate individual, private practice, et cetera. Would this bill be easier for people to understand if that one word where it says providers was just simply changed to facilities? I think in the case of an individual practitioner.
So, under that statute, I believe provider includes facilities under
Well,
the
it does, but it also-
RSA 151.
But it also includes individual private practitioners who are one-on-one, you know, particularly in behavioral health. I think some are perfectly aware that they have an attitude about vaccination where they really wouldn't be as much help to the patient as someone else would who's not got the same attitude about it. So that you might want to do that. But I mean, I thought you were aiming at facilities, that facilities couldn't turn people away because of vaccination status, not any individual practitioner. I personally can't imagine doing it. I'm very strong on masks and the other, but I would not refuse to see somebody who was not vaccinated.
Representative Knirk.
Yes, but this can't, I'm not going to make it a question. 151 does have to do with facilities. It's not providers. So since it is in 151, she's got the right place, I think.
So you support the idea of keeping that word providers?
No crosstalk until
sorry.
That's
Sorry,
okay, until the
sorry.
executive session. I
Sorry.
don't know why, but that's the rule. Representative Merchant.
Thank you, Mr. Chairman. And also thank you, Representative. Just for clarification, would you believe that in 151:21, Section 4, it says healthcare provider means any person, corporation, facility, institution either licensed by the state, and it goes on providing healthcare services, including but not limited to a physician, hospital, healthcare facility, dentist, nurse, optometrist, podiatrist, physical therapist, psychologist, any officer, employer, employee, or agent providing such care in the facility. So healthcare provider would you believe that?
Yeah, I would believe that. And the purpose of the bill is to make it so that no one is refused care for vaccination status. So if that's an individual provider or a facility, you know, I would like to see protection for these patients and make sure they can still receive care.
Follow up.
May I inquire, I guess, is what is the impetus of this bill? Because you have, in my opinion, sort of hit the nail on the head. Ethically, as a clinician, we're not able to, in a sense, refuse treatment to a patient. So I'm not quite sure exactly what is triggering the bill to begin with, what the problem is that we're trying to solve. Because from an ethical point of view, providers are bound to take care of the patient regardless of their status. And I'm not sure exactly why this is coming forth to this committee.
Thank you for the question. Well, I've received reports from many parents. Here's one. Dr. I'll take out the name, is a wonderful dermatologist who specializes in dermatology. Called to make an appointment. Voice message said you would not be seen if unvaccinated. Here's another one. We got kicked out of my son's PCP for not being vaccinated. names the primary care doctor. Here's another one. We got kicked out of our doctor years ago for not being vaccinated. We got kicked out. I have like several. And those were just for the last 2 days when I asked. And those were mostly PCPs and specialists. And like I said, that there is a more free market for that practice. And I think there's more options to find a different primary care doctor. So that's why I think that the facilities where people would be admitted, which is what this speaks to, are the ones that I would like to ensure won't refuse patients on that.
The chair has a question. I know that the facility of which I'm CEO can and occasionally does dismiss patients from the practice. And of course, we give them 30 days to find someone else if they can, and all the forwarding of medical records and whatnot. Would this be a carve-out saying that we can do that, but not for this specific reason? Because we can dismiss them as a facility, and
Correct.
our facility does it on the say-so of one of my several PCPs. Is this saying we can do that, but not for this?
Thank you for the question, Mr. Chairman. So it wouldn't apply to your business, but yes, the facilities licensed under that statute 151, they would still be able to dismiss a patient for other reasons.
Could they dismiss for this reason?
No.
Okay, so this is a carve-out of which there could be some others. Say you don't like people with AIDS or whatever. I mean, this could lead to a second one, could it not?
A second.
A second carve-out. You can dismiss people for any reason you want except for vaccine status, and then next year for another status, and so on.
Well, so this is in the patient bill of rights, and there are already, reasons that patients can't be denied care under that. They can't be denied or dismissed if they have Medicaid. They can't if they can't pay. They can't be denied based on their race or gender or age.
Are you saying that a patient cannot be dismissed for the patient's steadfast refusal to pay the copay?
That's for these facilities, that's what it says. Yeah, and RSA. Right. And that's what this applies to.
I've got a note handed up here that John Williams, who does not just work for the DHHS, but is also a font of wisdom, is willing to speak to this issue. And the only drawback is we don't have one. But he's being brought to the room.
Okay.
While he's doing that, I just know from having numbers of family members who are career medical providers, the oaths that they take. Mm-hmm. And they really do lean heavily towards treating people irrespective of. So thank you, John Williams, and the term is extern. Well, it takes turns, obviously.
Definitely the committee with the best sense of humor. So thank you very much for allowing myself, John Williams, for the record, the Director of Legislative Affairs, and with me.
Janice Emery, legal intern with DHHS.
And I just want to thank the committee and also the prime sponsor of the bill, for allowing us to come up before you just on a very limited capacity. We're here to provide information. A conversation came up, and I have to say that Representative Weber always attends the right class and the right school, because I actually think you were probably perhaps on the right issue relative to the placement of this law within our facilities licensing statute under 151. If you read the language, and I'm actually going to have Janice read us the language starting on line 3, down ending on line 5.
No healthcare provider licensed or registered to provide services in this state may refuse to provide care or services based on a patient's vaccination status.
And Ms. Emery, do we license providers under this section or facilities?
We do not license providers.
Thank you. So the correct placement for this, if the consideration is to having it apply to the provider's licensure as opposed to the facility licensure, and it's clearly written so that it applies to providers, and so therefore the appropriate placement, at least as it relates to physicians and surgeons, would be under RSA Chapter 329. And just putting it out there for your consideration and open to the questions from the committee.
Representative Woods.
Thank you, Mr. Chair, and thank you for taking my question. Excuse me. Under general practice, we've heard that the physicians and facilities are refusing because of this issue, and therefore you're right. Physicians, at least from the standpoint, are controlled by the Board of Medicine and have a certain standard of which they can practice. Have any of these been brought to the Board of Medicine that we heard? And I had my hand up to ask the prime sponsor, but I was not able to get in. Do you know, or would you have an opinion as to whether this would be the venue of the Board of Medicine if a physician were in fact, or a facility was refusing, again, a physician would be the Board of Medicine. It seems like that would be the avenue to start to begin with.
Yes. Okay. So realistically, the question that was posed to the department, as I filter out all of them, the first one, do we have any information from the Office of Professional Licensure and Board of Medicine on the frequency of these kind of complaints? I do not, because that's not our agency. It's another agency. Perhaps there's other members in the audience that I think are very prepared to provide you with that level of background information on that question, number one. Number two is, because we're talking about if you're looking at, and we're just working off the language in the bill in front of us that talks about providers, that if we're talking about providers and not facilities, the appropriate location for that would be in the professional licensure statutes. And if it is related to physicians and surgeons, and looking in anticipation for a question from Representative Merchant, that they are regulated by the Board of Medicine, at least as to those entities. There's perhaps other providers that the bill sponsored may want to include in that list. This was not meant to be all exhaustive list, but we just wanted to identify that the appropriate location should not be in RSA 151, which only licensed facilities. And even if you were to consider doing that, we would actually suggest other placement as well if you're going to go down that route. So we'd hope you don't. And again, we're not taking a position on the bill, but in the spirit of trying to get you the appropriate place where it belongs, we're trying to be helpful, that you've now received this bill in front of you as drafted.
Representative Cushman, would you be able to address Representative Wood's question as to whether such offending providers have been duly reported to the Board of Medicine?
Thank you, Representative Woods, for the question. I do not have information on whether those were, but I do know that non-disciplinary action, when they investigate complaints, if there's no official disciplinary action taken, it's not made public. So it could be that it has, but it's not on the website of actions taken.
Follow-up, Representative Woods?
Thank you, Mr. Chair. But I guess my real question is, do you know if any of these individuals have in fact approached the Board of Medicine to at least initiate that comment? It would still, that individual, if that were the case, if they were a non-disciplinary action taken, that would still be a notification to the patient, and the patient then would know. And it would have to get a reason for that non-disciplinary reason. You're true, it would not be publicized as disciplinary are, that's in the public domain. And in fact, everyone is published whether, anyway. But, so you're not sure?
No, I don't have confirmation that any of them filed complaints with the Board of Medicine.
Thank you. Representative Merchant.
Thank you, Mr. Chairman. I also thank Representative Cushman for taking the question. So I'm trying to understand and break it apart. There's the facility side and the provider. So in essence, what DHHS does is regulates the facility, and therefore they could talk about the access to the provider who's in the facility, which is different than a provider who's in the facility. So this could allow the facility to grant access, it doesn't really mean that the provider who's in that facility has an obligation ethically to treat the patient, but if they don't, back to Representative Wood's comment, wouldn't that go back to the Board of Medicine as a violation of ethics?
I wonder if it would. I would think so, but so where I put this in is the Bill of Rights, right? Patient Bill of Rights for patients who are admitted to medical facilities. And now that we've been talking about the phrasing, I noticed that the phrasing of this bill, the language deviates from the pattern that's in that Bill of Rights. All of the other rights of patients start with the patient shall. So I wonder if it would be appropriate to amend the bill and make it say the patient shall not be denied care based on vaccination status.
Follow up?
I totally agree with what you're saying. I think it's probably better in that location, and I think we should also talk about the provider separately, maybe in RSA 329, although I'm dangerous about doing that because once we do that in RSA 329, that deals only with physicians, physician assistants. It doesn't deal with dentists, podiatrists, optometrists, and so forth. So if we go down that road, we should be sure we amend all the other RSAs dealing with those providers. But I'd be willing to work with you on it.
I would believe that.
Sorry, Weber.
Well, once again, I think we may have gone a long way towards addressing my concern, which was this is very, very broad language in a very, very specific statute. So if you mean it to apply as the Patient Bill of Rights does, because it's in this chapter, to patients who are in residential care and health facilities, then it ought to say either use the language proposed by Representative Merchant or say in several prominent places under this chapter so that we know that it is limited to the facilities. But I don't think that's your intent, and the language here is very, very broad. And as Representative Merchant has already pointed out, would you believe that if that is your intent, that you need to get it into all the other statutes, which is a matter of some delicacy, having remembered all the negotiations that had to do with everybody who could prescribe opiates, which unfortunately included patients that were not only two-legged but four-legged and had very different considerations. So luckily you're out of that one, but there are a lot of different places in the statute that it has to go. And my other question is, did you intend to include all vaccination or simply COVID vaccination? Because it does not, the language here does not restrict to the COVID vaccination. It would include every single one of the vaccinations that we have been using for many, many years. And as the child of a polio survivor, I am very grateful for the climate in which I was born, where everybody went and got the polio vaccine. So,
Thank you.
Is it your intent that it apply to everything or just COVID?
Thank you for your question. It is my intent that it apply to all vaccinations.
Thank you.
Representative Folsom.
Thank you, Chairman Pearson, and thank you for taking my question. I want to put a scenario and make sure I've got this right. So a person who presents, say, at an emergency room and is admitted to the emergency room, has presented with some very specific possible issues that require certain protocols, and as soon as it's found out that that person did not get vaccinated, that all those protocols were then pushed aside. I wouldn't have, in this, it wasn't the facility's fault. It was what happened after I was already admitted. Well, I'm not supposed to say but
I think I'm
so
understanding.
would I then, are we talking then, someone would have to go to the Board of Medicine to report an issue rather than reporting to DHS?
Thank you for the question. I'm not sure how that would play out. I would think that the doctor wouldn't want to violate, the provider wouldn't want to violate the patient bill of rights that governs the facility that they work at. And I think both would be, responsible in that situation, but I'm not sure. The Board of Medicine could probably weigh in. But to speak to your scenario, I actually know somebody who was hospitalized in Massachusetts and had a ruptured appendix and was admitted, and when they found out that this person was unvaccinated and also was refusing testing, they completely changed their course of treatment. They were going to do surgery, and instead they drained an abscess and put him on IV antibiotics and said that they were going to discharge him that night. So it does happen. I think they could have just treated him as a presumed COVID positive and didn't need to go all of that to change the course of treatment, but that brings up one of the issues and why the bill is needed.
I have a question from the chair. I don't see any penalties in here. Is it assumed that if somebody is reported to the Board of Medicine or a facility to DHHS licensing, those two organizations would take care of any penalties to be meted out?
I believe those are the two bodies that would be dealing with this, yes.
Okay, Representative Leon.
Thank you, Mr. Chairman, and thank you. As we're looking at this and looking at enforcement possibly through the Board of Medicine, are you aware that they will issue confidential warnings prior to action that are not disclosed to anyone? And do you think it would be a good idea if perhaps we're sending such big ethical issues to the board that perhaps redacted statements of these should be going to Healthcare HHS Oversight Committee, just so that they can review a basic redacted one to make sure that these things aren't happening? Because if it's confidential, they're not able to discuss it.
Thank you, Representative. And I'm sorry if I haven't said thank you to you guys when you're asking all your questions. Yeah, I think that would be a good idea to add an additional layer of oversight. And kind of in that same vein where we were just talking about penalty, this statute in general has had some violations, as we saw when we had the bill HB 1439 about ensuring that patients have visitors. Some of that has been violated, and there are no teeth in this law, so it may be something else we consider.
Representative Snow. Can you do it? Part one.
Thank
Part
you,
two.
Mr. Chairman. Yes. Just a very quick question. Every healthcare facility that I go and every practitioner that I go to today require me to wear a mask when I'm being seen. And I think if I were going and to go, if the practitioner said, I'm not going to see you because you're not vaccinated, but if instead they said, I'm not going to see you if you won't wear a mask, do you see that would that be a legitimate reason to refuse to see him versus saying, I'm not going to see you if you have COVID?
Thank you for the question. I think a mask can be taken off and, can be worn temporarily. A vaccination can't. You can't undo it. So I think it's,
So you would have no problem. You're not saying that refusal to wear the mask while you're face-to-face with a practitioner would not be, you would not have a problem with that according to this bill?
correct. This bill doesn't touch on masking at all.
Thank you.
Representative Shapiro.
Thank you, Mr. Chairman, and thank you for taking this question. I'm still, after all this conversation, I'm still baffled if we're talking about facilities or providers. Are we talking about outpatient appointments within facilities or just in residential services? But regardless, if this bill were to pass, would you see telehealth appointments when medically applicable as an alternative to face-to-face appointments with someone who is unvaccinated. In other words, if a healthcare provider said, I'm not going to see you in person, but I will see you in a telehealth appointment, would that go along with the spirit of this bill?
Thank you for the question, Representative. I think it would. Like I said, they can dictate different policies to try to mitigate risk. You know, it doesn't say they can't do that. You just can't. The purpose of the bill, the intent of the bill, is just so that you can't just deny care outright based on vaccination status alone.
Follow-up.
It's not really a follow-up, but it's another question.
Another question.
It seems like in my experience, the issue of denying care before someone starts in your care, as opposed to after you've been treating somebody, are somewhat different. Practitioners, I believe, have a lot more leeway in saying that they're not going to treat someone who they haven't treated before, as opposed to their ethical responsibilities once they're already in treatment with them. So would your bill apply to both situations? If someone is first knocking on your door, or you've been treating them, you know, before you knew about their vaccination status? Would it apply to both?
I believe it would apply to both in this setting. So this setting is for admitted residents or patients of healthcare facilities.
Thank you.
Representative Gay.
Thank you, Mr. Chair, and thank you, Representative. I'm not quite sure how to ask this, but the subject of whether this is really an issue right now. Yesterday, driving here, listening to the news, I found out that a woman that I know, I didn't know her name, but she waited on me at the post office for 30 years in Salem, that she died after the hospital around Boston refused her monoclonal antibodies. So then they asked for old medication. They refused the ivermectin. They refused the best kind of respirator. And then they refused to transfer her to a different hospital. She died. So I'm asking, have you heard anything worse than that?
I have not heard anything worse than that.
And my second question is, if since this seems to be, from the help of everybody who's commenting, it seems like in line 4 because it's mentioning 15121 on line 3, to make it match 15121, then would it be better to say, instead of no health care provider, licensed or registered, may refuse, to make it match, we'd say no health care facility, and then for the providers, amend it so that it adds the other appropriate RSAs that cover those others.
Thank you for your question. To your second point, amending it and adding the RSAs that govern specific providers would cover the providers. But I think the issue with the language here and the statute the Patient Bill of Rights, is that the rest of that statute, the rights are listed as the patient shall. So an amendment to change it to the patient shall not be denied care based on vaccination status would be an appropriate amendment.
One more question?
One more.
Okay. We were seemingly wondering about the teeth, if somebody's violating this, and what could DHHS do? Wouldn't the absolute sharpest teeth be, if you're breaking the rules, we just withhold your license?
I don't know that would be the sharpest, but it would be pretty sharp.
Representative Leon.
Thank you, Mr. Chairman. Would you view transferring care to another practitioner, either in that facility or another one, as denying care? Or would that be another way for a particularly vulnerable or concerned practitioner to maintain care for that patient but not personally be involved?
Thank you for the question. No, I wouldn't view that as denying care. I think that would be a good option for patients within a facility. I mean, providers within a facility.
Thank you.
Representative Weber.
Well, I had a question, but I have a follow-up to Representative Leon's question first. And wouldn't rewording the statute to say the patient shall solve some of that problem, because the patient has a right to care then, but the patient does not necessarily have a right to be cared for by me. If I have a problem, but there is somebody else who is qualified to deliver the care that the patient needs, who is going to provide the care. It allows a great deal more room for providers to also exercise their individual rights. Is that true?
Yes, I would agree. Thank you for the question.
And follow-up?
Follow-up.
And I had one other word question is, would you be willing to consider, I'm having a hard time remembering how to phrase it because we're changing the phrasing, but it would be no patient shall be denied. And would you object to adding the word solely on the basis of vaccination status? Because I'm concerned about the cases where there are 3 other reasons that we deem valid. I mean, and then having a patient say, oh no, I have to be treated because of the other one.
Yes, thank you for the question. I would not object to inserting the word solely, and I actually thought about that too.
Yeah.
So thank you.
So that would help. Thank you.
Representative Woods.
Thank you, Mr. Chair, and thank you again for taking my question. Would you believe, relative to a phrase we heard earlier about confidential warnings, that often confidential warnings are meant to be confidential to allow the person, in that case a provider, physician, involved to respond and clarify. And sometimes, and I was involved in one such episode when I was a practicing physician, that there was a miscommunication, and the reason that it was confidential is it allowed me a chance to respond and clarify. So I just wanted that, are you aware that that confidential mechanism is in place?
I was not aware, but I would believe it.
Follow up?
Yes.
Thank you. Also, I think it's relative to Representative Folsom. Are you aware that oftentimes a physician who may be in private practice and then a facility purchases their practice, and that then will change some of the parameters in which they can, both economically as well as actual day-to-day procedures. So that can come into play, and therefore it makes it cloudy between if it's just for the provider, the facility may be impacting his response. Are you aware that that creates a little bit of a difficulty?
I understand. I think I understand your question. But this particular chapter describes the rights and responsibilities of each patient admitted to a facility, except those admitted by a home health care provider. So these are for patients who are admitted to the hospital or a nursing home, not those who are, seeing a specialist in a clinic inside of one of those hospitals.
I just want to make sure that we clarify, because we're talking provider being physician versus facility, and I think that has to be a distinction because of some of the economic relationships that some of these providers versus facilities have, and will impact what you're trying to do.
Thank you. Yeah, I understand what you're saying. So, language to clarify, I'm not against, but it seems like there's some movement on including providers also, instead of just facilities, so I guess, well,
Any other questions for the representative? Seeing none, thank you so much. The chair calls Catherine Michelotti, who has filled out a pink card. She comes from Derry. And wishes to speak in support of the bill. Thank you so much for coming.
Hi, thank you, Chairman, for accepting my testimony, I guess, and thank you everyone for having us here. I would like to testify as a parent who has had my child denied care for vaccination status prior to COVID even, because one of my children had a reaction to a vaccine as a young infant, and my doctor in another state had said, please make sure this child does not get this vaccine again. And despite that record being transferred to the state where we lived at the time, the provider refused to care for my child. And so we had to go on a physician search when my son was dealing with Lyme disease. And his Lyme disease was unchecked for months while I tried to find a physician who would see him because he had not had a pneumococcal vaccine. And so I would like to put my support behind this bill because I think it's very important for more than just current vaccines that are new. Thank you.
Thank you. Would you take any questions from the
I'd be happy
committee?
to. Yes.
Representative Merchant.
Thank you, Mr. Chairman. Also, thank you for taking my question. When that happened, was there a complaint filed with the Board of Medicine or the board overseeing that practitioner about the issue of violating what I consider to be their ethics, which the boards take seriously?
To be honest, there wasn't. As a mom who was dealing with a very sick kiddo, I didn't even know that was an option. I was just really concerned with finding someone who would take care of my child, and I did not know that that was something I could do. And I have a feeling I'm not the only one who knows, if I'm denied care, there's steps I can take. I did not know, and I kind of wish I had.
Representative Weber.
Thank you. And my question, I got a little confused in the moves between physicians. Was the care denied in New Hampshire, or was the care denied somewhere else in another state?
Thank you for the question. The care was denied in Massachusetts.
Thank you.
Thank you so much for your testimony.
Thank you.
Now, let's see if I can get Welsh Gaelic correct. Ewan? Awen? We know the answer. I cannot get Welsh Gaelic correct without help. Awen Osborne. Sorry for mispronouncing your name. Do you know what it means?
What?
Do you know what your name means?
I'm not quite sure. There's a lot of different takes on it.
But it's a pretty name anyway.
Thank
you for coming.
And thank you for allowing me to testify today and for listening to me, even though I probably am going to make 0 cents. Okay. Since the beginning of when COVID vaccines were first released to the general public, the unvaccinated have faced so much discrimination because of their decision not to inject potentially harmful substances into their bodies. And I personally believe that denying someone health care because of what they choose to do with themselves is completely terrible. I don't think it should be legal. Furthermore, I think it violates the Hippocratic Oath, which all medical service providers, I think, take. And it says that they will not do any harm, and denying someone care is doing harm to someone. speaking as someone who can't get the vaccine, I have an anxiety diagnosis, and to me and to my mother and to whatever doctor would have to administer the vaccine to me, it's not worth the panic attack. It's not worth whatever it's going to cause. I've also had a bad reaction to a vaccine before. And for me, I really just can't risk it. And the fact that I could be denied life-saving health care because of it just doesn't sit right with me. And I think I can say the same for my friends and family as well. I guess that's it.
Would you take questions
I
from
will.
everyone in the room who wishes you would be our honorary daughter or granddaughter?
Yeah, yes, I'd be happy to take questions.
Thank you. Representative Woods.
Thank you, Mr. Chair, and thank you for coming. I have a granddaughter about your age, and I understand your difficulties. Would you believe, and I hope you believe, that under no circumstances would you be denied any care that was even remotely life-threatening? We would never deny you care in that regard.
I don't really understand what you're asking.
This is a way we make speeches with it looking like we're asking questions.
Oh,
We
okay.
just want you to know from the medical community that we do care. And that may not seem like it at times. And sometimes we, as physicians, believe it or not, physicians have been known to make the wrong decisions in some circumstances. And that weighs as heavily on us as it does you. Trust me, I've been there many times as a surgeon. And we weigh on this very, very heavily, and we carry it with us day to day and night to night when things don't go quite right. So we appreciate, but just, we want you to know, when I speak, I'm sure for the whole medical community, we do care, and we will take care of you.
Thank you so much. I really appreciate that.
Representative Weber, a one-time second grade teacher.
A one-time second grade teacher, but I also have a would you believe question, which is how we ask questions without, how we make statements without asking questions. But would you believe that your testimony here today was really impressive, even without your age and even without anxiety issues? So the fact that you were able to do what you did is really, really great. And would you believe that at your age, I could no more have done what you just did than I could have grown wings and flown? So you are well on your way to becoming an advocate for whatever you want to advocate for in your life as you go forward. You're already way ahead of the game. And thank you for coming.
Thank you so much. I really appreciate that. It means a lot.
Representative Gay.
Thank you. Thank you, Mr. Chair, and thank you very much for testifying. And my question is, for the excellent presentation you've made, how old are you?
I'm 14, almost 15. Thank you for the question.
Well, thank you so much. And when you turn 18, sign up and run for the House, would you? We'll put you right in this committee. We'll all be still there.
Thank you.
Thank you.
And Amelia Jacques. Jacques? No? Okay.
Declined.
Rusin Chester from Bedford.
Absolutely. It's RUSSAN. First three letters of Russell, first three letters of Sandra. Thank you, committee chair. Thank you, committee members. I'm not going to tell you lots of stories because folks have already heard a lot of them from me. The only thing that I will say is that I am vaccine injured. I have a granddaughter that's vaccine injured from another state. We had to have her come to New Hampshire to get treatment because she was denied treatment in the other state, and she is now being denied treatment in this state. I also wanted to let you folks know that I have filed complaints with the boards, the medical board. One of the things is you don't know. They don't ever tell you what the consequence or the outcome of those complaints are, even as someone who files a complaint. What I can tell you is 12 years after I filed my first complaint about a specific doctor, he did lose his license to practice, but that was 12 years after my first complaint. And I really don't know how many people it took to complain against him before his license was pulled. So that's it. I just wanted to put myself out there. So if any of you folks have any questions to want to question me with regards to any of my personal experiences, I'm more than welcome.
Thank you so much. Representative Knurk.
Just a quick question. Was the person, the story you told, was that person denied care because of their vaccination status or because of the treatment they were requesting?
They were denied care because of their vaccination status. It was not COVID-19 vaccine. And solely vaccination status.
Thank you so much for being with us again. Michael Padmore from the New Hampshire Medical Society.
Good afternoon. Good afternoon, Mr. Chairman, members of the committee. My name is Mike Padmore. I'm the Director of Advocacy with the New Hampshire Medical Society. I'm here today to speak in opposition to HB 1003, not based on the intent of the bill. And listening to the bill sponsor, I think that we all agree on a number of different things. But I think that our opposition more comes from, we feel that the intent of the bill is covered by the current statute. A physician's responsibility to treat patients without prejudice or discrimination is a key component of the American Medical Association's Code of Ethics, which all physicians are required to adhere by in statute through Administrative Rule Med 501.02, which the New Hampshire Board of Medicine is charged with enforcing. Any patient who believes that a physician has violated this and those ethical rules does have recourse to file a complaint with the Board of Medicine, which we obviously have seen some folks talk about that today. We agree patients should not be refused care based solely on their vaccination status, but any decisions to refuse care should be made through thorough and thoughtful consideration of the medical ethics to which physicians are held and for which mechanisms are in place for this review by the Board of Medicine. Altogether, again, we appreciate the sponsor's intent of the bill, but we feel that it's important to allow for our state's healthcare providers to continue to make these ethical decisions based on the current statute of the law. And with that, I'm happy to answer any questions, and thank you for your time.
Representative DeLamus.
Thank you, Mr. Chairman. Thank you for taking my question. So,
And goodbye to our guests.
if the current statute addresses the problem that this bill or HB 1003 is trying to address, then why have patients been denied, as we've heard today, treatment for vaccination status?
As we've also heard, I mean, we don't know all of the details of all of these different cases, and if they've been brought to the Board of Medicine and reviewed and investigated, that is the current recourse, for folks to be able to resolve some of these issues.
Follow up.
Thank you. So, as the previous person who testified stated, she did complain to the board, and it took 12 years for one physician that she had complained against, and there was no follow-up to her as to know whether or not there was any recourse for what had happened. And if she recently has got a problem with having a family member refuse to get treatment, what is the recourse? Is there no recourse? Seems like there is not.
As I've stated, the recourse would be to go to the Board of Medicine. I don't speak for the Board of Medicine and their processes. Individuals, are still allowed to go to, to seek other treatment providers. If one particular treatment provider made a decision not to treat that patient, they are responsible for that decision. And through that recourse of the Board of Medicine, individuals always are available or always are allowed to go and seek treatment elsewhere.
Okay, thank you.
Representative Gay.
Thank you, Mr. Chairman. If I understand right, you are saying that a provider who does not treat you, if they refuse, you don't happen to, even if you report them, you don't know what the result is. And that sounds like you also don't get any kind of help while you are being denied treatment. Or do you agree that this proposed bill is mentioning, do you agree with the people who've said this bill is actually, by citing 15121, it's actually should be referring to facilities rather than providers? So in that case, are you a representative of facilities? So can you explain how this would affect facilities?
I should have clarified when I began my testimony. I realized that this bill does not specifically address the physician statute, but because there was reference to healthcare providers, I did feel that it was appropriate for at least to come and just speak to, I think, the physician's perspective on this. But I don't know if I can answer your question specifically, because I don't speak necessarily for the facilities.
Thank you.
Representative Leon.
Thank you, Mr. Chairman, and thank you for coming to answer questions on this today. My question is about oversight over the complaints process at the Board of Medicine. Is there any oversight on a top-level basis about types of complaint or anything else that's provided to any legislative body or to anything with anyone within the legislature?
Thank you for the question. I don't represent the Board of Medicine. I don't know if I can speak to that, but I certainly would encourage you to reach out to them and ask that same question.
Thank you.
Seeing no further questions, thank you for coming before us today. Chair now recognizes once again Dr. Gary York.
Thank you, Chairman Pearson, and all the members of the committee present today. Like others on the committee, I was a little surprised that this was put forth for possible legislation. As a physician, and other physicians have remarked, is this a problem? I mean, is this happening? And I felt like posing the question to myself out loud, would you believe this is happening in New Hampshire? Not knowing the answer, suspecting that it is, and Representative Cushman clearly gave testimony that it is happening. Now, I must admit that I'm not a little confused as to where this legislation belongs. In the main, I believe that patients need this protection. It's sort of a proactive bill in a way, in that patients really need to know that they have the right to be treated and not refused for medical treatment. People have mentioned maybe this belongs in the Bill of Rights, patient rights, and I, not knowing much about how laws are made and enacted, I would agree with that to my limited knowledge of that. But the question of where it belongs can be sorted out by people much smarter than I am. But I do strongly believe it belongs. It belongs somewhere because, as others have stated, there's discrimination going on. And I think I need to clarify that it needs to be written down somewhere that the public can access this information, that this woman who gave brave testimony with her family that she was denied treatment, but she wasn't aware that she was able to bring that to the Board of Medicine. I think if this were somewhere in the public record that, yes, as a patient, this is your right, and that you have a right not to be discriminated solely on your vaccination status. And I would agree that, yes, this is appropriate to include all vaccinations. I'll take questions.
Representative Gay.
Thank you, Mr. Chairman, and thank you for taking my question. In lieu of, since, you know, as a person on your side on this issue, I appreciate your coming and testifying. And so do you have any suggestions? Because, you know, people really want to make other people safe as well as themselves. So do you have any recommendations that ought to be part of public health to try to be an alternative to this not so great way of protecting with vaccines?
I think what I would throw forth as someone who's not vaccinated is please lose your unfounded fear of people who are unvaccinated. We're not full of germs. We don't have any special evil superpowers to infect others. It is clearly known that the vaccinated and the unvaccinated are equally able to transmit the disease. Perhaps if you're vaccinated and you have the assumption that, oh, I can go and gather and travel and meet with a lot of people because I've been vaccinated, well, that's not practicing safe distancing. But I'm getting off topic here. But I would recommend that people lose the unfounded fear of the unvaccinated as someone who might be someone to fear. I mean, we're just regular people. I mean, there's no difference between me and anyone in the room as far as risk of spreading disease, depending on what your habits are.
Representative DeLamus.
Thank you, Mr. Chairman. Thank you for taking my question. Do you think that the this should also be in the statutes that regulate the providers such as nurse practitioners, physicians, dentists, PASs, et cetera?
I think it should include all health providers, yes.
Thank you.
And there was a question before that had comment on like telehealth. Could that be an accommodation for a way to, a telehealth could accommodate someone so that you wouldn't have to refuse treating a patient. So that would be an acceptable accommodation, for sure.
Thank you, Doctor. Do I see Representative King?
Thank you, Mr. Chairman, and I'll take a stab at this question because I think I'm as confused as you are. It sounds like there's two problems, and the bill addresses one of them, but there's still another problem. So people are being, from the testimony I've heard this afternoon, it sounds like people are being discriminated for not having vaccines. And people that have actually known about how to file those complaints either don't know what's the outcome is, or nothing comes of it, or both. Is that where your confusion is as well?
Not having been on the Board of Medicine in New Hampshire or any other Board of Medicine, I'm not fully aware of the practice that they do in evaluating complaints against physicians or healthcare providers. So I guess to answer your question, I am confused because I do not know. It is known, I do not know.
Thank you.
Thank you. Seeing no further questions, thank you very much for your testimony. Thank you. Next, we will call from
Good afternoon, Mr. Chairman, members of the committee. From the record, Paula Minahan, Senior Vice President, State Government Relations for the New Hampshire Hospital Association, representing all our hospitals. The New Hampshire Hospital Association is in strong opposition to House Bill 1003. This bill prohibits healthcare providers from refusing to provide care or services based on patient vaccination status. This bill, in our opinion, is simply not necessary. Let me be very clear and direct. Hospitals do not refuse services or care to anyone, period. In addition, from a technical perspective, the statute being amended is confusing. RSA 15121B is actually the Home Care Client Bill of Rights, which is not specific to health facilities per se. It also has nothing to do with individual providers. It is unclear what the sponsor of the bill was intending by the term healthcare provider licensed or registered, as that is also confusing to us. Concerning healthcare clinicians, New Hampshire registers med techs only, so it is not clear why this term is being used. New Hampshire licensed clinicians that provide direct care to patients. RSA 151, as was discussed last week, when another bill, House Bill 1044, sponsored by Representative McLean, was heard, is related to health facilities only. No individual provider falls under this statute. And all the examples that I wrote down by the sponsor were talking about individual providers, pediatricians, dermatologists, et cetera. I also would like to emphasize that hospitals treat all patients regardless of their ability to pay, and certainly they are agnostic when it comes to vaccination status. The current hospitalization data bears this out, with nearly 35% of those in the hospital as we sit here today with COVID-19 are not vaccinated. I would argue that this fact clearly demonstrates that this bill is misplaced and unnecessary. Further, the Emergency Medical Treatment and Labor Act, it's a national federal rule, law, EMTALA, requires hospitals with emergency departments to provide a medical screening examination to any individual who comes to the emergency department and requests such an examination, and prohibits hospitals with emergency departments from refusing to examine or treat regardless of their ability to pay. On behalf of our healthcare heroes who have been tirelessly and compassionately caring for patients with COVID for the last 2 years, I ask you to reject this unnecessary bill. And honestly, I find this offensive to our healthcare heroes. Please stand with me and the overwhelming majority of New Hampshire citizens that support our healthcare heroes and find this bill inexpedient to legislate. Thank you, and I'm happy to provide any answers to questions that you may have.
Questions for Ms. Minahan? Representative Gay.
Thank you, Mr. Chairman, and thank you very much. And as a person who lives here, I'm very grateful to hear that the hospital policy is that you are not discriminated for your vaccination status. However, this bill is supposed to cover many kinds of facilities. Do you speak for them too?
No, I represent the hospitals.
Okay, thank you.
Representative, I'm sorry, go ahead.
Sorry, it's not related to Representative Gay's question. I just wanted to make one more statement, but I want to take questions first. Sorry.
Representative King.
Thank you, Mr. Chairman, and thank you for taking my question.
Sure.
I'm often reminded about why law exists in the first place, and it's usually because of the misbehaviors. So you mentioned healthcare heroes, and I'm sure there's a lot of them out there. But what do we do about the ones that are misbehaving? As we heard from testimony today, there are people that are being denied healthcare, whether it's at a local provider or wherever it is. And we've also heard that the method of them bringing that to the light is not really being handled very well. What's your take on that?
Thank you for the question. So again, this bill, as has been stated by many very experienced legislators on this committee, this is amending RSA 151. And again, I don't think it's not, the Patient Bill of Rights is 151.21. And what I wanted to say is that a statement was made that the hospitals are currently violating the Patient Bill of Rights, and I take offense to that as well. They are not. A individual that is a child always has a patient, a caregiver or a parent that's allowed to come in if they are in the hospital. So the visitor policies are staff. But what you're referring to, again, talking about pediatricians and the like, that falls under the Board of Medicine or the appropriate clinical board. 151 is the licensing, health facilities licensing board. And there is, I think Representative Gay said, the recourse is the Department of HHS. If a violation is filed with the department, the hospital their license is in jeopardy. That's really ultimately what 151 is all about. So I think this is really an OPLC, Office of Professional Licensing and Certification, question. And if that's the intent, that is different. And again, as Mr. Padmore said, I also do not represent the boards. So I think that's a question for the boards.
Any other questions?
Oh, yeah, I think I said what I wanted to. Yeah.
Did you speak to the point you didn't speak to when you said you were
I
going to
think
speak to
I
it later?
I think I did. The other note I wrote is that relative to determination of how, this is well beyond my scope, but Representative Knurk raised this, I think, relative to organ transplants, et cetera. They have ethical committees, and I suspect both of these wonderful retired physicians sat on those at one point. There are ethics committees that make those determinations relative to organs, et cetera, where you end up on that transplant list. So that is really referencing, when you started talking about that, I just made a note about the ethics committees that hospitals engage in those discussions.
Thank you so much.
You're welcome, thank you.
And the chair now recognizes Kelly Potenza from Rochester, New Hampshire, who wishes to speak in support of the bill.
So I drove here today because I didn't know how many people were going to speak in support of this, and I have been working tirelessly for months as, in a sense, a kind of a patient advocate. I've been working with Southern New Hampshire Medical. I've been working with Cottage Hospital on behalf of patients that, in a sense, are getting discriminated against. So, in all due respect, the reason why we have to do things sometimes is because, yes, there's tons of heroes out there, but there are people that are breaking it. And so, where is the recourse currently? So if we make a complaint, where does that go? Unfortunately, if that complaint doesn't go anywhere and it doesn't have money tied to it, nothing's going to change. And so even this legislation, what happens? What happens if somebody's refused? I can give you 4 dentists right now. I can give you 4 pediatricians out on the seacoast that are denying parents they don't want their kids because they're not vaccinated. And so this is way more than COVID-19. This has been going on in New Hampshire for quite some time. It's basically like, we don't want you. So this is the whole beauty of medical freedom, right? You have the choice to take a vaccine. And by the way, COVID-19 is not a vaccine. It is, let's just be crystal clear about that, okay? It is an experimental gene therapy injection that is not FDA approved. It's only been approved for emergency authorized use. And the only reason why this has had to come up is because of the COVID-19 injection. Right now, I don't know if you guys realize this, but the veterans hospitals here in the state of New Hampshire are not, you cannot get help. I can give you names if you want them. I'll send it out to if these people are okay with it, because we're trying to find them other practitioners that will treat them, because if they don't have the COVID-19 injection, they're not allowed to get any treatment from the VA hospitals right now in New Hampshire. That's going on. And so let's talk about what Southern New Hampshire Medical is doing. Or how about Dartmouth-Hitchcock? These hospitals all have systems. They're called Epic and Cerna and all of that. So when you are, let's say you're in a life-threatening situation and you go to the hospital, they're gonna ask all of this information about you. So let's say that's me. They're gonna ask, all of these, personal information. The 6th line on a medical record right now for Southern New Hampshire Medical in Nashua is COVID, basically it says COVID-19 vaccination, or it says patient is not vaccinated for COVID-19. How does that have anything to do with anything? Are they asking about MMR? Are they asking about flu? Are they asking about anything else? Which those are vaccines that have gone through this rigorous testing years and years. They're not. So why would that be on somebody's medical record? That right there is discrimination. I can tell you right now, my girlfriend's father was killed at Southern New Hampshire Medical because he was not vaccinated. He went in there to get oxygen, and they literally left him there to die for 1 week. They didn't feed him. They didn't give him IV fluids. He was like, yeah, did they treat him? He was there. He was admitted, but they didn't give him any treatment. This is going on in New Hampshire. Unfortunately, it shouldn't have to be necessary, right? They're right. It shouldn't have to be necessary, but we actually live in a world right now when something is so polarized and out of control that we actually have to have legislation like this. We have to pass laws like this, but it needs to have teeth, because if somebody's denied any of this, they need to lose a license and they need to pay big time. So that's where I'm at. Any questions?
Any questions from the committee? Representative Gay?
Thank you. Without naming anybody, would the man who died happen to have a daughter who's a chiropractor in Salem?
Thank you very much, yes. So you know about her, okay.
Yes.
There you go. And there'll be a lawsuit forthcoming soon.
Representative King?
Thank you, Madam Chairman, and thank you for taking my pseudo question. Would you believe I'm no longer confused? Thank you for your testimony.
Seeing no further questions, thank you very much.
Now, is the prime sponsor interested in working on an amendment for this? This is not an early bill, but it does have to be out the door by the middle of March. Representative Merchant indicated interest to help you. There are a couple more that you can find, and you can pick them. It's your bill. I mean, it's our bill, but it's yours. And just let me know who's on the group, and we'll be looking forward to getting something in due course.
Thank you. Thank you, Mr. Chairman.
And this concludes the hearing on House Bill 1003. We'll give it about 2 or 3 minutes just to stretch and look around and whatever. Any cookies?
Cookies. Oh, doesn't that sound
killed
good?
their catch.
There's extras. Yeah. If you already have them, there's
Oh, they did it upside down. She gave it to everybody. There was a vaccine passport.
However, I must say, my mother was in elder care in Rochester, and she had all of this term, and granted, she was elderly, Alzheimer's, the whole thing. She didn't remember all her teeth knocked out, something else knocked out. I don't know. I had no idea, so she comes in, she smiles at me, I'm like, oh, this is And so I called the hospital, and I'm like, what happened to my mom? She said, she's knocked it out. What happened? Oh, well, we don't know. I said, how do you not know? How do I leave my mother in your care? You have her for a week. I get her home, and she's now missing her tooth. So they took her all out of bed. What happened? When did
I look to see if they come from Concord. I look to see if they come from Concord, that's it. Otherwise,
I called
bing, bing, bing.
elder care complaint department. I complained with them. I went nowhere.
Usually I send back, I agree with you.
Goes right down the toilet. There's no recourse, no follow-up, no, I mean, like, through the state, there's no nothing. They want to hide out of the seat bags. They want to hide out of the bags. So it's really, really, really bad. My experience has been horrible.
It wasn't so funny. Yeah, you got that far out. Oh, gosh, I wish I had some water, too. Sometimes I am, sometimes it's gone.
My mind is gone.
Yeah. Yeah, well, when I went, because of this fall I had, I went into the hospital and it was determined that I probably had a concussion. As soon as the nurse found out I was not vaccinated, and I told her it was a decision by my doctor.
Did you bang your head?
Yeah, but, you know, she found out, and so they were supposed to check on me every 15 minutes.
Oh, wow.
They left me in a room by myself. I was shivering. I was crying after a while. I finally got off the gurney thing and got my coat and put it on. And then finally, when somebody came from radiology, over an hour later, she comes in and says, "Oh, did you pull your cord?" Spear. I've been treated wonderfully by them before. So, I mean, it was just like night and day. And I said, it is the decision of my doctor for me not to get this. That once one comes out, that's the more normal type of vaccine, go for it. But because she has some other patients with the same neurological conditions I have, and she said they all did really poorly.
Right.
And she goes, just put it off as long as you can. You know?
I want to talk to you. Concord Hospital, if I'm admitted to the hospital.
Right, well, we have you guys in the Oversight meeting over.
Yeah, and we're swamped with strangers.
Yeah.
That doesn't mean that I'm pushing it
Now
off.
now they have
I don't have to
hospitalers.
work hard to get my agenda full every month. But it should be, I mean, what kind of oversight if you're not overseeing it? Somebody needs to be. She's very thoughtful, she goes into detail. And
And of course, no one, the person who drove me couldn't come in. So here I am with a concussion, hopping around on one foot, trying not to fall over. You know, so.
I've got a couple of things that, I've got a little cyst here. said, I'm pretty sure it was not cancer. It was cancer.
That'd be different,
She
yeah.
felt it, she said it's moving around. She said cancer doesn't matter.
Good, good, yeah. Some of those are, they bother you, but, you know, as long as they're not growing, you know, or whatever.
It's, I've had an x-ray twice, and the second one said no change. From the first one said something along the name cyst. We're doing good. Boy, this really got interesting. Yeah, I'm pitched off already. Cancerous, but she said they don't tend to say that because they're afraid of being sued. This little flap down here that always flips up. But she said from her point of view, she doesn't think it's.
Yeah.
So I was able to.
You know, I didn't even think of complaining to any medical boards or anything about what happened here. It's not gonna make a difference. But I don't like to go to hospitals anyway. I've spent way too much time in them and.
Never enjoyed hospital my whole life until 6 months ago.
Wow.
90 years old before I ever went in. Time we do this. It was a fall and
About
a minute. Sure.
Right. Oh, sure, yeah.
Take care of our, transact our business in there and get there at the same time.
Way to go.
And that was the priority.
Of
As you
course.
well know. All right, cool, thanks.
Mhm.
So they had another nurse. Ready. And she said, this is very serious. And they need to go to the emergency room right now. My doctor later said it was her first day on duty and she didn't know what she was doing. And she said there was no reason.
Being overcautious, yeah.
So they sat me there without my clothes on in the hallway until 5 o'clock at night when the doctor came. And he says, hi, Jim, what are you doing here? And Gary, could you gather the little folks from the hall, please? Thank you. You know, there's nothing like that. That's right. And then the bill would come out.
Yeah. Well, I actually had a case once where the emergency surgeon that worked on me did a terrible job. And the doctor that I, neurologist I ended up going to see after that was like, we have to completely redo your surgery. And I said, are you serious? And at that point, I was still not sure I should go to
Open the hearing on House Bill 1099, prohibiting the Department of Health and Human Services from requiring vaccine passports for services. Prime sponsor, Representative Terosian from Atkinson.
Good afternoon, and thank you, Mr. Chairman and members of the Health, Human Services, and Elderly Affairs Committee. For the record, my name is Peter Terosian. I'm one of the state reps that represents Rockingham County District 14, which is the town of Atkinson and Plastow. I'm here today to testify on behalf of House Bill 1099 as the prime sponsor. 1099 is an act prohibiting the Department of Health and Human Services from requiring vaccine passports for services. It's a pretty straightforward bill. It's designed to prevent discrimination based on one's immunization status. Vaccine status, in my opinion, is private medical information. It should stay that way. Last year, the Department of Health and Human Services attempted to have public hearings regarding the possibility of establishing a passport mandate. This legislation, if enacted in House Bill 1099, should prevent such a mandate from becoming created. Again, this is a very simple bill, and it is designed to ensure that every person has the natural, essential, inherent right to bodily integrity, free from any threat or compulsion by government to accept any immunization. Accordingly, no person may be compelled to receive an immunization for COVID-19 in order to secure or receive access in any public facility, public benefit, or any other public service from the state of New Hampshire or any other political subdivision, including but not limited to counties, cities, towns, school districts, etc. I ask that the committee find House Bill 1099 ought to pass. With that, I will be glad to take any questions that the committee may have in regard to this bill.
Representative Weber.
Thank you, Mr. Chairman, and thank you very much for taking my question. Just as a point of clarification, because we have had a number of bills that deal with this same subject matter, want to be sure that this bill is not in any way in opposition to the department issuing vaccine cards or documentation for those people who want them and need them.
No, this bill does in no way speak to doing that, but it does prevent the department from requiring a mandatory passport.
I just
vaccine
wanted to
passport.
be sure that they would still be available to
Yes,
those who
yes,
want and need them.
this would not affect that in any way.
Thank you.
Thanks for the question.
Representative Soloway.
I don't think it's on yet.
On?
Oh, more power to you. Better.
Here.
I think I'm dead. Oh, there we go. Thank you. Oh, don't take it away, Representative. I apologize, Representative Terosian. In line 12, you specify that an individual has been vaccinated against COVID-19. What would you like to do when the next epidemic comes around? Are you going to pass another bill identifying that health threat of the community, and then another one and another one? Or would you like perhaps to create a more general statement to push forward your intent that no one should ever have to produce a passport? Thank you.
Thank you, Representative, for the question. And when I did go to OLS to draft it, I tried to intentionally keep it open to just COVID, and they added the 19 in there. So if you want to do an amendment, or the committee does, I'd be, I think that would be a good amendment to strike that so that it does cover any future variations that may develop. Thank you.
Representative Knurk.
Actually, kind of go a little broader, and that is, should it even say COVID-19? Should it just say has been vaccinated, period? We just spent a long time talking about a bill that had to do with, all vaccinations or just COVID-19. And of course, the names may be totally different. It may not be anything to do with COVID. And I don't know whether it should be broadened to any vaccines. I kind of doubt that the department would ever deny care anyway, but I can appreciate your intent of making sure it doesn't happen. Should it be even broader?
I wouldn't object to that. Again, the intent is to protect all New Hampshire citizens in their private medical information, and to ensure that we don't discriminate and create a class, those who are vaccinated and those that aren't. And, I can't predict what's around the corner, but, Mother Nature, the way she is, there'll be something else down the road, and it may or may not be a COVID type. Yeah. So the more broad we could make it, and the more we can cover any future possibilities, I would be open to.
Representative Merchant.
Thank you, Mr. Chairman. Thank you for taking my question. We have a long history in this country of having a separation at the federal to the state level. We don't want the federal government telling the states what to do. However, this bill basically tells us the cities and all the local municipalities and so forth what they should do. Is that my reading of this bill?
Thank you for the question, Representative, and I would say no. What this does say, though, is that they can't, again, discriminate against you with what your status is. So, for example, if a local town or city wants to create an ordinance that you have to wear a mask in town hall, this wouldn't affect that, but it would prevent them from discriminating against an individual in any services they may provide on their vaccination status. It's that simple.
Follow up. No? No? Okay. Representative Leon.
Thank you, Mr. Chairman, and thank you, Representative Trojan, for taking the question. Am I right to read this that it's only prohibiting discrimination or separation based on an irreversible invasive medical procedure as opposed to those easily reversible ones like masking or other temporary measures?
Well, right. If you look at the title, it involves vaccine passports. So it doesn't say, masking passport. So no, that's not included in here. That's why I brought it up in the case of a local governing board that wants to enact a mask mandate. It wouldn't prevent that.
Follow up.
And follow-up is that then this is preventing, this is basically looking to that irreversible choice of being vaccinated. And if the science ends up shifting, then is this intended so that people don't have to take one even if maybe 6 months or a year later they're no longer important?
Yes. And as a matter of fact, one of the points that I didn't make that I had written down is that we're learning more and more about the COVID, the new strains that are coming out, and we're compiling data in regard to the transmission of COVID in relationship to whether you're vaccinated or not. And we're learning as we go forward, particularly with the newer strains, that very similar numbers of people are transmitting the new strains, whether they're vaccinated or not. Doesn't seem to make much difference. So, I'm hopeful that the newer strains are going to be less catastrophic to people. They certainly seem to be. But irregardless, I guess the point is that I think as we look at statistics and we look at them honestly, we're finding that having a vaccine passport or mandate isn't what we thought it was going to be in regard to reducing the spread of the disease. So the intent is to, again, reinforce people's constitutional rights and their right to medical privacy in regard to their vaccination status. Thanks for the question.
Thank you.
Representative Gay.
Thank you, Mr. Chairman. Thank you, Representative Trozian. Would it make any difference, because we're using the term passport, but we also want to return, which many of us are opposed to passports, but we don't want to stop producing proof of vaccination for the people who would like to have one. So would you have any objection if the wordsmithing somehow used, maybe, I don't have an answer yet, so I can't even make a proposal, but something about, like you defined passport in the statement. You defined the passport as proof, but in this case, that's what it means. But in other cases, as one other representative was asking, how do we retain the right to get a proof, but you use it in some cases as passport? I know I'm going all over the place. I'm not quite sure exactly how to address this, but is that okay to define words as long as the intent is exactly the same?
Well, I think the way that I have it written is pretty clear that in regard to not requiring somebody to have to use the word passport, there's other word you could use, to not, basically intent of this is to ensure that we don't require somebody be vaccinated to receive services in the state. Nowhere in the language does it say that you can't provide vaccination cards for people that choose to be vaccinated. Indeed, we're doing currently. I don't see the language prohibiting that, but I do believe that should be done on a volunteer basis. So if you want to have that done and that information available to you, you will be able to. If I don't want to have it, I would have the right under this not to have it. I don't want to be put on a registry of people where I'm segregated by, again, my vaccine choices. I hope I answered some of the question. Thank you.
I agree.
Representative Weber.
would you believe, and would you believe that I hope that Representative Gay believes, that I believe that this language still permits me to get the documentation I want on a voluntary basis if I need it, without any interference in that. It is only the requirement broadly as an access to services that is prohibited here.
I would believe. Thank you.
We do that here. Representative Shapiro.
Thank you, Mr. Chairman. Thanks for taking this question. Having read through the Medical Freedom and Immunizations Act, I guess it could be called, it's already fairly broad, and you are adding that it will not prevent people from accessing department programs, benefits, or services. I assume that means Department of Health and Human Services. So I'm just thinking about the intent of this bill and what services might the department keep people from accessing. Are we talking about things like Medicaid or TANF, or what services are you trying to prevent people from being discriminated against with?
Thank you, Representative, for the question. And if you look at the bold print, it does refer to the Department of Health and Human Services shall not require a vaccine passport as a condition of eligibility for any for or access to department programs, benefits, or services. In this section, vaccine passports mean standardized documentation that an individual has been vaccinated against. So it's, I think, pretty broad, but broad so that it includes any and all services that they provide. So I'm not specific to just a handful, because I wanted to keep that open for any and all services that may be obtained.
Okay, thank you.
Representative Weber.
Thank you. And again, for purposes of clarity, I'm wondering, because the existing language already says no person may be compelled to receive an immunization for COVID-19 in order to secure, receive, or access any public facility, public benefit, or any public service from the state of New Hampshire or any of its political subdivisions. Does that not already cover all of the services provided by the Department of Health? That's part number one. And part number two is the issue, not the passport, but the requirement of the vaccination itself, which is what the first half of the bill speaks to. Aren't we simply stating the same thing in different terms and confusing it by using two different terminologies for the same concept, which is, my understanding is that your concept is you don't want anybody, based on their COVID vaccine choices, to be denied benefits. Well, the statute already says that, doesn't it?
Well, I believe it does to some extent, but I want to, this legislation is intended to make sure it includes the Department of Health and Human Services, because let's face it, they're one of the, probably the biggest state government agencies that has tremendous power to dictate, if they so choose, and to make rulemaking. So this wants to clear, what the intent is to clarify that the department doesn't require, a vaccine requirement. And I guess the reason why I wanted to put that into language was because, as I mentioned earlier last year, they did start having public hearings with many people showing up concerned that they were interested in creating a mandate. So this is to clarify and to prevent that happening in the future.
Follow-up, Representative Weber.
Thank you. And again, in the interest of clarity and simplicity, if I believed that such language was necessary, which I personally don't, but if I believed it did, instead of introducing the concept of vaccine passports into a statute that was written about vaccinations, would it not be more efficient and just as conclusive to say no person may be compelled to receive secure receiver access any public facility, any public benefit, or any public service from the state of New Hampshire or the Department of Health and Human Services or any subdivision. The Department of Health and Human Services probably needs to go to the end of the line, but if you added DHHS into that list of people who this is not includes and is not limited to, wouldn't that accomplish the same thing without introducing the apples and oranges problem into the statute?
Thank you for the question, Representative. It may. I'm not an attorney. I consulted with OLS, obviously, when we drafted this and made it pretty clear what my intent was with the legislation. Could it be done another way? Perhaps. You know, that's something certainly you all as a committee can decide if you think the language is sufficient. If not, I'm certainly open to an amendment as long as it keeps the intent, which I hope I've communicated what the intent is here. And if the committee agrees, I hope you consider OTP. You know, I certainly would be, again, open to amendments if you believe that would streamline and be a little clearer. I certainly would could support that.
I believe I saw Representative Merchant's hand. Yes.
You did, Mr. Chairman, but Representative Weber asked the question very eloquently. Thank you.
Representative Snow.
Thank you, Mr. Chairman.
Wow.
The first time I heard the word passport used in this context was to fly on an airplane. And, you know, later I guess there's been some conversation to get on a cruise ship or anything like that where it's going to leave the country, it'd have to have a passport. Now, I haven't dug into this. I haven't explored it. I don't know many facts about it. But if I have a card that says I've been vaccinated, is that the same as having that passport? And can I get on an airplane? And can I do all the other things? Or does that then require some other step to be taken for that area? And secondly, does that mean only the department and state-run facilities and probably subcontractors from that state, but private businesses could require a passport or at least certification of vaccination status under this law?
Thank you, Representative, for the question. And I think the reason we use the term passport is because that's been bantered about quite a bit now throughout the last couple of years. And you know, you do need a passport to enter other foreign countries. And there's many organizations out there that are looking to require what they're terming a vaccination passport to get services in other areas. So, but to answer your question in regard to private industry, no, it doesn't discuss private entity in here. It's pretty specific, the state of New Hampshire, any political subdivision, towns, cities, and so forth. So, no, it doesn't prevent that in answer to that part of the question.
Okay. I believe Representative Shapiro? No? Wave off? Okay, thank you, Representative Terosian.
Thank you, Mr. Chair and committee. Enjoy the rest of the day.
The chair recognizes Frederick. No last name, but I bet he has one.
This one. Hello.
Hey.
My name is Frederick Bonilla. Oh, sorry, excuse me. My name is Frederick Bonilla. I'm here basically just to represent the people. I really felt the calling because my friend wanted to come. I'm not really, I'm not really understanding why people are trying to agree on the killing and murdering of other people's family members and loved ones just because they're not their family. It's one of the saddest things that I've seen, that people want to agree. People want to be in line, seeing people falling dead in line to receive something that you guys know very well has been killing our family members and our children. I don't understand how you have states like New York City and California that are going to actually, anyone who's ever been through any type of discrimination should not even think about this bill. I mean, to think about allowing people to continue to inject our family members for their death. We've seen it with famous people. We've seen it not with famous people. We have people walking out all the time. The CDC themselves put it on their website that if you get the injection, that your own immune system is 97% stronger than if you get the injection at 94%. I think it lowers your immune system as soon as you get it in there. Who wants to do that? They said it themselves. TED Talk 2014, Mr. Gates already talked about killing all of us. But people want to sit around and think that that's not true. They want to point fingers. He said it himself. It was out of his mouth at a TED Talk. And here we are, how many years later? Exactly what he said he was going to do on that TED Talk is exactly before us. And then they cause it. And then they're going to think that after causing people to suffer and go through all these things, and then putting them out of work because of something they created, that you're not going to give them the help that they need? That is not America. You're not representing America at all. That is not, I'm not even from America. But the things that have been happening, and I take pride from my America, the real America, the people. This is the most disgusting thing that I've ever seen in my life. For everything that is said, from my country, 'tis of thee, all the way to the end. Ever since you guys took that out of our schools. And thank you for those who fought for our country, because it's because of you that we're free to this day. And by far, why would anybody and their children allow that to happen? Our freedom's getting taken away daily. And it starts with this stupid thing that kills our people. I think that's it.
Thank you, sir. This is really compelling and heartfelt. Appreciate you would come today.
Thank you.
Share that, and welcome
That was
to
the Lord.
America. I hope we treat you well.
Yes, please do not allow people to continue to die because of the sake of people in power that have the ability to do that. Somebody has to speak for us. And we put you guys in there for that specific reason. Don't ever let us down, ever, please. And you better spread it to the rest of them, too. Because that's all we have. And in the end, that's all we have right now. Is America the great. Don't let it fall for nobody.
Thank you, sir. We've got several people. I'm glad you're one of them today. Could I now call up Bruce and Chester, please, to the speaker's table? Roseanne,
Thank you.
I'm going to get it. You keep coming. I'll get it.
I'm sorry. Give me a second.
It's all right. It's okay.
That is exactly what we're trying to protect. We're trying to protect that right in New Hampshire. You all know that we have taken money now from the federal government that has vaccine passports and central registries and this robust response to COVID. The bottom line is we need our representatives in New Hampshire to protect New Hampshire's citizens. When we've gotten to the point now in our state that we don't trust our federal government to protect us anymore. We don't trust all the New Hampshire Hospital Association, DHHS, all these different levels of big corporation. Many of you may not even remember the Ma Bell controversy with monopolies. But bottom line is, that's what's happened with our healthcare system. That's what's happened with the healthcare system. And discrimination is happening. It's happening more and more often. And yes, do the unvaccinated need to become a protected class, or we need some kind of protection? Well, once upon a time, we didn't need protection for sexual identity. We didn't need protection against, I remember the feminist movement. Back then, we needed protection, so we got it. Why did we need protection? Because our government and our media and our corporate people corporations had begun to discriminate. Now is the time to stop the discrimination. All levels, race, religion, sexual orientation, vaccination status. Unfortunately, vaccination status is real. Because it has been politicized, we need to respond. Thank you very much for your time, and I'm open to questions.
One question by Betty Gay.
Thank you. Thank you very much. And may I assume that not only you, but the man before you both support this bill wholeheartedly?
Thank you for the question, Representative Gay. I would like to be able to say that we don't need this bill. I would like to be able to say we have enough government already. Unfortunately, when government starts putting the power of their own ideas above the responsibility or the representation of the people, then we need protection. So yes, I truly support this bill, but only because it's basically to stop big government. My opinion.
Thank you for your testimony.
Thank you.
The chair recognizes Kelly Potenza.
So I know I'm not supposed to be able to ask questions, but I'm pretty sure that this amend RSA 141C1A has to do with the bill that was passed last session, which is HB 220, correct? Okay. I spent a lot of time on that HB 220. So this is the reason why we're here, unfortunately. HB 220 really didn't protect anybody. You know, we spent a lot of time and a lot of testimony. Thousands of people were all about this because they wanted to be protected. So if you look at UNH, this is a great example. UNH did absolutely the polar opposite of this, because then again, HB 220, they were compelling vaccinations for their students, denying religious exemptions, and then also for all of their faculty and staff. Well, based upon how this was currently written, without having this in here, they should have been protected, but there was no teeth to it. So then what do you have to do? You have to go spend thousands of dollars to hire a lawyer. You have to pull your kids out of that school. I mean, it's crazy. And it really shouldn't be just for public, because there's no real private business in the state. If that was the case, then I could just go open up my own little bagel shop tomorrow, and then I wouldn't have to pay anything to the state or anything like that. It doesn't work like that. But we're not going to go private and public because I know that can't happen. But when it comes to adding this line in, we have to add that in. And this is the reason why. It has to do with vaccine registry, right? So this goes back years. We've been wanting to build this for a long time in New Hampshire, and we've taken in federal money once, twice. Now we've probably taken in federal money 3 times. Millions and millions of dollars to build this vaccine registry that's actually never been built, which is really creating, in a sense, the haves and the have-nots. It's creating an online vaccine passport system. So if we just look at our state constitution and our Bill of Rights, this is beautiful. Article 2B, right of privacy. This right here protects us. So if we strip away all of these laws, this is what it comes down to. An individual's right to live free from governmental intrusion in private or personal information is natural, essential, and inherent. Wow, that's all we need right there. And that should negate everything else here. But we have to continue to, because we're not really following the law of the land, we have to continue to put layers upon layers upon layers. From HB 220, which becomes law, that doesn't really protect anybody, and now we have to put this in because, yes, DHHS is an overreaching organization, and I'm sure they're going to be coming up here to testify and oppose this and blah, 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 but this is where we are. So no one in any way, shape, or form should have to show anything to go out to eat, actually, or go to a museum because, you know, is it the Courier, I think it is, in Manchester that's now requiring a vaccine passport? Isn't that wonderful? Do they take state funds? Yes, they do, but they're still considered a private business. Let's strip away every single dime that they've received from state funds, grants, and all of that, okay? Because they're requiring that. So this is what we've got to have bills that's wonderful, but there has to be teeth to it. We have to hold these people accountable. So that's where I'm at.
Thank you so much. Would you take a question?
Sure.
I don't see one, but thank you for coming back. The chair now recognizes Dr. Jay Corson from Manchester to support this bill, and welcome back. And let's make sure we stick to this bill. We're not going down ivermectin or any other thing that we will do again, but we're not doing it today. It's just this.
I understand, Chair.
Yes, sir. That wasn't addressed at you. That
No,
was
I
addressed at
get it.
anybody who is listening.
I find it odd that I'm sitting here again. I went back, took care of some patients in Manchester, came back, specifically to testify again. And don't you find, on both sides of the aisle, don't you find it odd that we're sitting here discussing whether we're going to discriminate against somebody based upon their vaccine status? Whether they'll have to provide a piece of paper that says that they were vaccinated or not in order to receive what they're entitled to in the state. 2 years ago, if you think back in your mind, 2 years ago or 3 years ago, would you have ever thought that we would be?
Excuse me, we have a
Yeah.
point of order. Yes, Representative Weber. Thank you, Representative. Please speak to the bill directly.
Thank you, Representative. So this bill is asking that we don't require a vaccine passport or the proof of a vaccine in order to receive services in the state. And what I was saying is it's a shame that we have to even ask that even have to have a bill like this. But we need to support a bill like this because if we don't, we'll go down the same rabbit hole that required vaccines, required masks, and other things that we've seen over the last 2 years. We'll emerge and we'll say, wow, we didn't think that was possible. This will prevent that. And that's why I'm in support of it. Was that succinct enough, Representative?
That was magnificent. Thank you.
Thank you. Thank you, Chairman. That's all I have to say.
The other side of the aisle agrees.
Yeah.
Any questions for the doctor?
Thank you for the time.
Thank you. And the chair recognizes Catherine. I bet you know Frederick, right?
Thank you. I just want to thank you all for this bill. And I struggle with anxiety also, like that little girl, so it made me cry. I have a wrongful conviction out of Rockingham County, and there needs to be a bill to protect inmates and people on parole and people that are in institutions. I absolutely do not consent to this wicked vaccine. It is poisonous. It has caused a genocide in this country. It has caused, according to VAERS, V-A-E-R-S reporting site, which is only 1% of the instant deaths, have been over 25,000 instant deaths in this country. It is unacceptable. This vaccine is killing people, and I do not consent to it. I don't recognize my country anymore. I see videos on YouTube of people being arrested for going to Burger King for a hamburger because they didn't have a vaccine passport to get into Burger King. And they're being loaded into vans. And this is happening in America. And I don't recognize my country anymore. I also want that on the record because you don't trade your freedom for your safety. Safety is a guide of tyranny. And you don't cancel the Constitution or replace it with other laws. That's not what our forefathers died for and gave their lives for. People fought and died for basic freedoms in this country. And we're of a different generation. It's not, we didn't fight and die. It was our grandfathers that did it. But they did it. And they did it so that we would have freedom now. And we need to have freedom. We have to have more freedom in this country because it makes my heart sad to see the changes in our country that I see happening. And I meditate and I pray, and I have a very strong spiritual connection, so I can see through a lot of this, and I've done a lot of independent research. And people are under a spell that needs to be broken. This yoke needs to be broken. It's not healthy for mental health or physical health. It's really, at the end of the day, about, the elite getting money and power and people dying.
Catherine, we're getting to the end of the day here, and we want to be sharp and listen to everything.
I'm sorry.
So
I
could
just
you
want to, I
it.
appreciate this bill. I'm thankful for this bill because I get services for SSI and things, so I don't want to be discriminated against ever. I don't think anyone should be discriminated against for their health reasons or the color of their skin or or whatever the reason is. No one should be discriminated against. And so I want to thank you all for listening to me. I apologize because I'm new at this, but I just want to say what was on my heart. I want to live in a free country.
You've done a good job. Really, thank you. I'm going to ask if you would take a question from
Yes, sir.
Representative
Thank you.
Cushman.
Thank you, Mr. Chairman, and thank you for your testimony and for taking my question. Speaking about the correctional facilities in New Hampshire, while you were there, was it while a vaccine was available for COVID-19, and did they try to, okay.
I wasn't there at that time, but I've experienced horrors there. I've been treated and abused terribly there. I was charged wrongfully. I was entrapped by the police 14 years ago. I've had no justice in Rockingham County, even after filing affidavit after affidavit, legal filing after legal filing. And we need to protect bodily autonomy. I've been abused in the mental health.
Catherine, we're going to thank you for coming.
I just want to protect other people.
I hear you, and Frederick too, and thank you both for coming, and I hope the next time you go into Burger King, it's going to be a great success.
I'm not going to go into a
for
Burger King in New York City.
Well, I wouldn't either, but anyway, for a lot of reasons.
And I don't want that to come here.
Yeah.
I'm born here, raised here. I'm 41 years old.
Catherine, we're going to move on because we've got a clock that's biting us. But thank you both so much for coming. And I'm going to ask Abby Rogers and Anne Marie McCurry to come up. And
good afternoon, Representative Pearson, members of the committee. I'm Abby Rogers, Legislative Liaison for DHHS, and I'm here with Anne Marie McCurry, Bureau Chief, Section Chief for Immunization. And we are here to provide information on HB 1099.
Good afternoon, Chairman Pearson and members of the committee. Currently, RSA 141C1A states that other than the exemptions that are specified under paragraph 2 and 3, no person may be compelled to receive an immunization for COVID-19 in order to secure, receive, or access any public facility, any public benefit, or any public service. The addition of this language, as proposed by HB 1099, is therefore unnecessary, as documentation of vaccination in any form is not required by the department unless where COVID-19 vaccination requirements is authorized under paragraphs 2 and 3. Where COVID-19 vaccination is required, a standardized document of vaccination is necessary to serve as evidence of vaccination. Currently, COVID-19 vaccination records are issued by providers who administer vaccination to the recipient or the recipient's guardian at the time of vaccination. The language of HB 1099 defines vaccine passport to broadly include any standardized documentation that an individual has been vaccinated against COVID-19. If HB 1099 were to pass, then the department's standard documentation for vaccination would be considered a vaccine passport. Thank you.
Thank you. I just wanted to add in that listening to all the testimony today with the concerns of the sponsor and also the really great point that Representative Weber brought up about HB 220 sort of already encompassing the concerns of what the department can offer and does not offer a vaccine passport, has no intention of doing that, that it would be, if it was amenable to the sponsor, maybe the committee could consider adding in on line 6 after New Hampshire, including but not limited to the Department of Health and Human Services, and maybe considering not including the rest of the legislation. That would be something that we would offer up as something that would be amenable and helpful to the department and to clarify the legislation. Thank you.
thank you. Representative Weber.
If it were to read any public service from the state of New Hampshire, the Department of Health and Human Services, or any political subdivision of the state in New Hampshire, and then including but not limited to all those things that it's already including but not limited to, would that satisfy your concerns?
Yes, it would.
Thank you.
No further questions? One further question. Representative Folsom with a further question.
Thank you, Chairman Pearson. Thank you for taking my question. My question is, for those people that have an exemption for religious reasons, rights of conscience, medical reasons, would they receive an identical card so that if they went someplace, they didn't have to pull out something else so everyone would see that, oh, you're one of them? So would they be able to receive the same identical card that everyone else gets with saying, nope, no vaccine, but she's approved?
The department feels as though there are multiple systems in place to allow for those medical or religious exemptions, and those documents would be a separate and distinct card from any vaccination card, because those people would not be coming in for vaccination, hence would not be eligible to receive a similar card.
Follow-up.
If we had to have something totally different, wouldn't that, in a sense, be discriminatory towards those people that don't have a vaccine? It just is an open door.
Thank you for the question. I'm not sure if we're aware of anybody has requested a non-vaccine card at the department, or a card saying that they haven't been vaccinated or they've chosen not to have the vaccine. Is that correct? Okay.
I'm, oh, sorry.
No.
Okay, I think it's not just that, but I'm thinking if a card was issued and someone wanted to go to a museum that was not allowing people without a vaccine, but this person had an excuse, a allowable excuse, but they don't have a vaccine card. So boom, they can't go in. Would you provide an identical card so it's proof that they've gone through the process and have that exemption so that they could get into that museum?
Thank you for the question. I actually would think that that would be dependent on what the regulations are of the private business that's not accepting them. I mean, just to say that I think that if they're saying that no one who cannot be vaccinated can enter, then that probably, I don't know if they would accept religious or medical exemptions for entrance.
I'm just looking at my card here and holding up that other paper which says I have a religious exemption. And you know what? If I'm in a line of people and they all have a nice card like this and I have this yellow paper with the other words on it, I might feel that people are glaring at me if I'm lucky, and worse if I'm not. So would you believe I see the merit in what Representative Folsom is saying?
I would.
Thank you. Representative Weber.
But isn't the distinction there that the exemptions are either medical, in which case they're based on a medical provider's opinion, or they are an exemption from a workplace, and the department doesn't have anything to do at all currently with that, and the issuing by the department of such a card would necessitate setting up yet another registry. Is that true?
Yes, that is correct. We would not have oversight on issuing any sort of card for that type of, that's not within our purview.
Representative Knurk.
I think mine's similar. Just, would you agree that this bill has nothing to do with private places or anything? This has to do only with the DHHS, and it says you can't ask for a passport, so there's no reason to worry about an alternate passport. Would you agree with that? So it's kind of off topic to do this?
Yes, I would agree. It's not, we are here to talk about the language in the bill, and I think those questions, although thank you for asking them, are not really under purview.
Would you believe that, despite my respect for the representative, it does not just talk about DHHS, but it talks about other political subdivisions and water districts
May
and
I
so
respond?
on. Representative, did I mishear you?
But what it's saying is you cannot ask for it, so why would we need to worry about an alternative for something that cannot be asked for?
Okay. Representative Cushman.
Thank you, Mr. Chairman, and thank you for taking my question. So from what I read, the only new part of this bill is the bold part. Everything else is current law. And what the bold part, the in bold text seeks to do is just to make very clear that the Department of Health and Human Services can't require some standardized form of proof of vaccination in order for people to obtain DHHS governed benefits and services. So, is that correct?
That's how I read the bill, yes.
Follow up?
Follow up.
So, therefore, we're, I guess I guess that's it. Thank you.
Thank you.
Representative Gay.
I need clarity on here. The brand new part of the bill seems to be, and this is really a question because I want to know if you think it does. Could we get the same meaning out of it by skipping the new words, just adding in the Department of Health and Human Services on line 6? And then that would be protecting everybody, that you cannot need to show proof Well, it says,
What a
on the
great
first two
idea.
lines, it just says you don't need it. So you wouldn't, it would be immaterial whether you had proof or not.
Yes, we would agree with that.
Yes, so follow-up question.
Yeah,
Who makes these
you're on
cards?
a roll.
Who makes these cards? It's just everybody who gave out immunizations, they gave cards? Is that where all these various cards came from?
Sure, so the CDC goes ahead and they issue the cards to the state and the providers who are in receipt of vaccine. So as vaccines are being delivered, they're also receiving the cards to go alongside them. So a vaccine administrator would go ahead and have an individual in front of them. They would fill out the record at the time. They would hand the record over to the person who's receiving the vaccine or the parent or guardian.
And then the vaccine registry? A follow-up question?
Yeah,
Okay, there's a vaccine, currently vaccine registry in flux. So would the person giving the vaccine be the one to enter it into whatever system we have, which isn't settled yet?
The information would flow to the New Hampshire IIS or the registry only if a person does not elect to opt out of that. So if a person says, no, I don't want my information to flow, that individual has the right to maintain that information on their own accord. If the vaccine were received at a pharmacy or provider's office where there is an electronic medical record, the medical record would show evidence of the vaccination and the person would be given the card, so the person would be able to obtain a copy of that record if they were vaccinated in a provider office or elsewhere where there is an electronic medical record. And the opt-out only applies to the information, the IIS, the immunization system, where a person would elect to not have that information flow over, and that information is controlled by the healthcare provider, whether the information goes or not.
Thank you.
Thank you for your question.
thank you so much. And with that, close the hearing on House Bill 1099, but my sense is there could be an amendment that some folks might like to work on. Representative Weber.
I'd be glad to do an amendment that's based on what I proposed and what Representative Gay seemed to think was a good idea, which is listing DHHS specifically in the list.
Would you like anyone to help you? I know you can do it on your own, but
If it's acceptable to people,
Well-
I just take it over and
Yeah.
give it to OLS. And if it's not acceptable to people, I'll take it to OLS and you can vote it down and I'll write a minority report.
well, we don't do that here for the most part, write minority reports, because we all agree on things. So I'm sure you're going to do it. Mostly. I'm going to ask the committee not leave. We have one more item after this.
The tradition of the committee is we present the best bill we possibly can to the floor to be voted on by the House, and when we cannot agree, we
I know.
present the best possible policy arguments on both sides of the question, so that the House may listen to them and decide for itself.
Absolutely so. So Representative Weber, if anybody wants to whisper in her ear on her walk, that's up to you. I find it extraordinary how, God spoke to numbers of people simultaneously about much the same thing. I like that when it happens. In terms of this language.
Still working on
What's
what's
that?
happening with my ear.
Yes.
Thank you, Mr. Chairman. I'd be interested in working on an amendment to give that section of law some teeth, if anyone else is interested.
Well, I don't know. We could have two amendments brought in, or we could have one mother of all amendments brought in, or whatever. Representative Weber, that's yours if you wish to do it or not. Either one is good.
I'd like to try it and see it, and then go from there.
Would you like to try to work with the representative, or try to bring forth what you had thought?
I'm going to bring forth what I suggested, and
Okay.
we're well into an executive session now.
We are.
But there can always, as a committee, adopt 2 amendments if we choose to do so, and OLS will magically merge them into a 3rd amendment
I
if
like that.
2 are approved by the committee. And on you go from there.
Good? Okay, I'm going to close what was an executive session, you may not have heard that earlier, on 1099. And now, wait for it, this is going to be good. The clerk is ready for this. This is use as many sheets as necessary, and I now open an executive session that we're all going to have great fun with, to House Bill 1390, and the chair proudly turns it over to Representative Knurk, who will walk us through procedures like you've not necessarily seen before.
We've already exec this before.
We're reopening it.
We're reopening.
Yes. We heard it before, there was an error, so we need to revisit it.
Did I just see something pass me by?
It's an event all. I gave you one.
Oh, you did, I'm sorry.
I
And I'm
need one.
looking at it.
Oh, I guess he figured.
Okay, get out 1390. If you have it, you weren't told we were going to, so you can look on with somebody else. What you are now, so. Which I am now, yes. All right, Representative Knurk, walk us through the process, please, sir.
Okay, here's the problem. We exec this last week or the week before, no, it was last week, I think it was. This is the one that has to do with language translation services in telemedicine. The difficulty that we identified at that time is that it was actually placed in the wrong RSA. And John Williams gave us guidance as to which RSAs to use. I brought forth an amendment, which is the amendment, if you don't have it, don't worry, 0210. And that was the one that just placed it in the proper statutory reference in New Hampshire. So I was then, of course, because I made the motion, was supposed to write the committee report. As I sat down to write the committee report, being the compulsive retired surgeon I am, just for kicks, I went to check the CFR citation that was in the original bill and the amendment.
For the record, we exected on January 24th.
Right. And when I checked that, I was a little surprised because it was not the right Code of Federal Regulation citation. It was citing CFR that had to do with insurance exchanges, that you had to provide translation and so on and so forth for selling insurance. It had nothing to do with care, and this bill has to do with providing care. So with that in mind, I worked then with the OLS people. We found the proper CFR reference, and we inserted that. So this amendment that I've just brought to you, which is number 0409H, is a replace all amendment. What it does, it's precisely the same as the one that we passed on the 24th, except that it corrects the citations. Instead of 45 CFR 155.205, it's 92.101, and the other one is .102, because 101 has to do with language access and 102 has to do with deaf and hard of hearing. So the issue is, it's an error in citation, so I worked with the clerk, Paul Smith, to sort out how we correct it. The correction would be that I would move reconsideration of our decision on the bill from before. Then, please, everybody votes yes. That means we can open that back up and reconsider it. And I can do that because it was unanimous, so we all were there. And then we will vote no on the OTPA with Amendment 0210, which we passed back on the 24th.
You can just offer a next amendment.
Yes, exactly.
You don't have to do no on what you did.
We don't even
You
have to
just
say no.
offer
So
a
I will
further
offer, after
amendment.
reconsider, I thought reconsideration was on the vote that we'd made. You reconsider a vote, you don't
Oh, you're right.
Yeah,
Never mind.
so we will reconsider the
We got
vote,
this-
therefore.
We got this from the clerk.
Yeah, that's right. So I wanted to streamline it because poor Beth is going to pull her hair out, but strand by strand. But the issue is, if we reconsider that vote, we can then overturn our previous decision, so it's no longer have a recommendation. Then I will move the amendment. We pass the amendment. Then we'll move OTPA. we all agreed with this bill, it was unanimous, it's just simply to correct an error in citation. So that's what this is all about. It's a little complicated, and you may wish that I hadn't checked it, but we didn't want to get into law incorrectly.
The chair recognizes Representative Knirk for a reconsideration motion.
Yes, I would like to move reconsideration on the motion that we passed on the 24th, which was on HB 1390, ought to pass with Amendment 0210.
And Representative Acton had seconded originally, so I will accept a second from him. Reconsideration, having voted with the prevailing side, we can do that. When you're ready, Chair,
Okay.
we want to vote yes, we're going to reconsider.
Press the, no. Representative Leon.
Yes.
Representative McMahon. Oh, no, was he still here? Representative Acton. Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey, absent. Representative King.
Yes.
Representative Kofalt, absent. Representative DeLamus. Yes. Representative Weber.
Yes.
Representative McKay.
Yes.
Representative Snow.
Yes.
Representative Knirk.
Yes.
Representative Soloway. Yes. Representative Cannon. Yes. Representative Nutter Upham. Also yes. Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Affirmative.
Representative Pearson.
Yes.
19-0.
Now, the motion on the floor is,
The new amendment.
yeah, I know what it is, I'm just trying to find it.
It's OTPA with Amendment 0210.
No, we have to vote down.
That's what I mean. That's what I'm talking about. The previous motion was OTPA with Amendment 0210. That needs to be voted down now.
We now have to do ITL on that, or?
No, that was an OTPA. We don't vote on ITL, but we're now reconsidering that vote. We're saying we do not vote for it.
So a no vote will kill
Kill.
the mistake.
OTPA.
Yes.
The
Not the bill,
previous
just the
vote was
mistake.
just, shall we think about it and do it? Okay. Chair will recognize somebody to make a motion.
Reconsideration means we just re-vote on that
Right,
motion.
revote as if we never voted
The
before.
motion's already on the floor. We're reconsidering it.
Now we have to vote no.
Yes.
Right.
But they were reconsidering a vote that's there. I don't have to make the new motion because now that means we have not acted upon that motion. That motion is now the motion on the table.
The
Not on the
motion
table.
on the table is the bill we don't like.
Right.
No, we're starting over it.
We,
We're starting over at this point.
Yeah, we're starting over. Basically,
on, I
this
can hear
is
one
as though we
person.
had never voted on the previous OTPA.
okay, so we never voted on the previous one. I'm not sure that's what I had heard, but,
We did, but
We-
now
we
we're
did.
voting on it as if we didn't vote on it.
Right.
so that original bill as amended is now on the floor.
Yes.
Yes.
And we want to vote no.
Yes.
And we vote no because then we can
Okay,
make the new
good,
amendment.
yeah.
Yeah, we're not ITLing. We're
No,
voting
we're-
no on the OTPA.
The vote is on OTPA, and that is on what we had done back
Amendment
then.
0210. That is the
no.
old amendment.
Okay, good. Who's going to make that motion?
We just put
I don't
in,
think we need to. It's already on the table. We
It's
have
on the
reconsidered it.
table.
because
Yeah.
Knirk and Acton.
Just write Knirk and Acton.
I wrote Knirk and Acton.
It's Knirk and Acton. You heard them here.
Sure.
Okay, when you are ready, we do this, and we want to vote no. Thank you.
You know how late I'm going to be up tonight trying to figure this out.
Good luck.
No, we already-
No,
vote
we've
no.
Vote no, Ken. We've been through this once before, as I recall. Yes.
Basically, remember, when we're on that, when we're in a house.
Representative Leon.
Yeah.
No.
Representative McMahon. Representative Acton. Representative Gay. Representative Cushman.
No.
Representative Folsom, no. Representative Kelsey, absent. Representative King.
No.
Representative Kofalt, absent. Representative DeLamus. Representative Weber. Representative McKay. Representative Snow. Representative Knirk.
No.
Representative Soloway. Representative Cannon. Representative Nutter Upham. Representative Shapiro.
No.
Representative Woods.
No.
Representative Merchant.
No.
Representative Pearson.
No.
19
19 to
to 0.
zip. Now, we can consider the new amendment. The new amendment you were just handed, 2022-0409H. Representative Knurk, would you make a motion, please?
Yes, also just to clarify, everybody, this is just like we see in the House sessions where something gets passed, it's very controversial, somebody says, I move reconsideration and urge everybody to vote yes. We don't have to repeat the motion, it's already on the table, you're reconsidering. So that's why we didn't need to redo that then. So I now move Amendment 409.
Now we're voting on the new
Sorry?
amendment.
The new
Yeah,
amendment.
this is the new
The old
amendment,
one.
the new
Because the
amendment
old one
that I
was
just
no
handed
good.
out, 2022-0409. I move that amendment.
Second, I will take Soloway's hand. So this is the amendment, and when you are ready,
In just a moment.
it's on the amendment 2022-0409 to the original House Bill 1390, moved by Knurk, represented by Soloway.
Representative Leon.
Yes.
Representative McMahon. Yes. Representative Acton. Yes. Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey, absent. Representative King.
Yes.
Representative Kofalt, absent. Representative DeLemus. Yes. Representative Weber.
Yes.
Representative McKay. Yes. Representative Snow. Yes. Representative Knurk.
Yes.
Representative Soloway. Yes. Representative Cannon. Yes. Representative Nutter Upham. Yes. Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes, 19 to
19 to
zip.
0.
Now, before I accept the next vote, Representative Shapiro, 23 people signed up in support of this and 0 against it.
Thank you so much.
Yes,
You're
sir.
a hero of democracy.
Keep me honest, sir, please. Now, we have the possibility of someone moving House Bill 1390 as just amended by 2022-0409. I see Representative Knurk's hand up. Is there a second? Second. Oh, you just had one. I'm going to give this one too. Did I see a hand over on this side of the pool? Okay, you don't want to second just anything, but this is a good one. So, so the bill as newly amended, and Representative Knurk and Gay, and we know what we're doing here. Are you ready?
I'm ready.
Go.
Representative Leon.
Yes.
Representative McMahon. Yes. Representative Acton. Representative Gay. Representative Cushman.
Yes.
Representative Folsom, yes. Representative Kelsey, absent. Representative King.
Yes.
Representative Kofalt, absent. Representative DeLemus. Representative Weber.
Yes.
Representative McKay. Yes. Representative Snow.
Yes.
Representative Knurk.
Yes.
Representative Soloway. Yes. Representative Cannon. Yes. Representative Nutter Upham. Yes. Representative Shapiro.
Yes.
Representative Woods.
Yes.
Representative Merchant.
Yes.
Representative Pearson.
Yes.
19 to 0.
And Representative
And-
Knurk, would you write the committee report, please?
Of course, and I presume consent.
And what's that?
Consent?
Done.
Yes.
Do I have it?
Yes.
Yes.
It's
No,
already
no, not been sent, consent. Consent on this bill?
Consent, yes.
Yes, but I will, of course, write the report.
I know it can,
And I
yeah,
will try not to compulsively find any
You
other
know-
errors.
and you're writing a blurb.
Yes,
And
that's
they-
what I mean, of course.
Thank you.
Just so
And-
you know, that they give the clerks executive session form for 4 votes on a bill. This is the very first time I've ever filled the whole thing out.
The chair wonders, should there be any third-year law students in the room? Wasn't that fun? There is one. Look at that. What are the odds of that? Okay, we are now concluding the executive session on 1390. Yay!
Well, we got it done. I think it's time for a margarita myself, but I have to drive, so. depends on how empty my stomach is going into it.
Yes. Well, as that went, I had already filed your number, entered through the community committee, and handed the back of the beginning. It was already